Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, International Interdisciplinary Institute for Research, Education and Skills, along with our all senior dignitaries who are associated with us as guardian, as resource person, Dr. Wickramarachchi ji, Dr. Bishnupriya Sharma ji, Dr. Harish Verma ji, Dr. Jagdishwar ji, and our respected expert Rajan Patankar ji, expert speakers. Really, I am grateful to all that within very short notice, everybody has accepted the invitation to start to bless us on this platform. And definitely, we are really grateful for all dignitaries on the dais and off the dais. First of all, I would like to communicate my best message. Congratulations for the festival of Holi. Hope you have enjoyed Holi today. And today really is not need of sleep, but unfortunately or fortunately sleep day is there because everybody is tun, either tun in bhang or tun in daru. So everybody is tun. So today is no need of sleep without medicine because they have taken enough or green or red, whatever that they have taken, but enjoyed Holi today. So today can sleep, but from tomorrow, the sleep is very necessary. In our Ayurveda also, Ahar, Nidra and Brahmacharya, three are the upastham of our body. So definitely, I would like to welcome Vishnupriya Sharma ji and requesting him for his welcome address. Welcome, sir. Dr. Vishnupriya Sharma.
Okay, namaskar. Respected Professor V.K. Agnihotri ji, Dr. Pawan Kumar Sharma ji, Madan Thangavale ji, distinguished guest, learned audience, distinguished speaker. Namaskar, good evening to everybody. Wish you happy Holi to all of you. Today, our seminar topic is best and safe sleep therapy. Yes, it is most essential for maintain health. Sleep is required. And nowadays, most of the countries all over the world, sleep disturbance, loss of sleep, insomnia create a big problem. Yes, medicines are there, but how our medicine or how it act or what type of procedure we have to follow to have a good sleep. So in this today's webinar, our eminent speakers are Dr. Pratibha Shah, Professor Vineetha V. Kurup, Dr. K.C. Priyadarshanee, Dr. Bishnupriya Mohanty. So I welcome all the eminent speaker and all the distinguished guests and audience for this webinar. And I declare webinar is open. Namaskar. Thank you to all.
Thank you very much, sir. Thank you for your blessings. Now, today we have new speaker from USA. Dr. Pratibha Shah is an internationally renowned Ayurveda expert, intentionally trained in traditional health sciences, Ayurveda as well as energy healing and public health. Pratibha Shah ji distills Eastern wisdom with an understanding of Western principles for the best care of her clients. A strong sense of compassion and empathy, intent listening skills, in-depth, thorough assessments, and contemplated individualized master wellness plans are hallmarks of her 30 years of practice. Very long CV, but she is founder, president of the Wellness Health Alliance, founder, president of Council of Ayurveda Research, founding director of Ayurveda Anusandhan Abhiyan Foundation, India, and CEO of My Ayurved LLC, and launched the brand by Swa Stha, SWA, STHA. So without wasting much time, I would like to request Dr. Pratibha Shah ji, who has problem to speak, but really I salute her passion that she is ready and now she is going to bless us on this event. Welcome, Dr. Pratibha ji. And this is your first inning. We would like to give you travel humbly forever. Hari Om.
Thank you so much, Dr. Pawan Kumar ji, and all the esteemed experts today who are present here listening and who I have the honor of speaking with, my fellow speakers for today. I would like to thank Ayush Samriddhi, especially Dr. Pawan Kumar ji, for this wonderful initiative where you are holding educational seminars almost, I think, every day, if I'm not mistaken, which is a very big undertaking. So congratulations to you on that, and thank you for inviting me. And just to let you all know, I basically had my first wisdom tooth removed 2 days ago. So till yesterday I was swollen. But I had told Dr. Pawan Kumar ji that I will come and I will be able to speak. Certainly, it is my honor and pleasure. And I also want to say that I used to be in the Ayush ministry. I am actually a colleague of Dr. Katoch and Dr. Nesari. We were 12 selected in the same UPSC batch. So after my MD in Rashastra from NIA, I had gone directly into Ayush, which was not Ayush at that time. It was Directorate of ISM. So 13 years I was there, and I was Chief Medical Officer when I left. Then after coming here, I did my Master's in Public Health, and I have been practicing, teaching, and also managing 2 nonprofits. Council for Ayurveda Research is the one that connects me with India very frequently. So it's my pleasure, privilege, and honor to be here. Today is World Sleep Day, so it is very timely and very important topic to be talking about today. I do want to apologize in advance that after my talk, I will just be able to stay only 10 minutes because it's bright early morning here. So we have, consultations and meetings lined up. So with, advance apologies, I will get started. So basically, I'm using my existing slide deck to give an overview of sleep. So I will try to kind of set the tone for today's series of talks. I will start with some general and some specific points from Western perspective as well as Ayurvedic perspective. And then I'm certain that you will be getting a lot of specific information from the rest of the speakers. So with that, and with your permission, I'll get started. So I'm going to start sharing my PowerPoint. Give me 1 second. So the topic for today is best and safe sleep therapy. I will get started with, as I said, an overview. So I will do a mainstream perspective. Mainstream means Western perspective. Here in the West, allopathy is referred to as Western medicine or mainstream medicine. Then concept of sleep in Ayurveda. I'm going to skip the key sleep disorders because I have only 20 minutes. And then simple tips for an optimal sleep experience. So let's see what is the mainstream perspective on sleep. So here are some very basic and simple characteristics that define sleep. Sleep is something that is natural, easily reversible. Each word, each term is important and accurate. It describes sleep very well. So sleep is something that is natural. It is easily reversible. It's periodic. It's a periodic state of many living things marked by the absence of wakefulness and by the loss of consciousness of one's surroundings. All these should be checkmarked. Most of these should be checkmarked for a good sleep. accompanied by a typical body posture, such as lying down with the eyes closed, occurrence of dreaming, and changes in brain activity. This is important. The brain activity has to change for deep sleep experience and physiological functioning. So there should be a change in the status of the brain activity as well as physiological functioning. A good sleep is made up of cycles of non-REM sleep. REM is rapid eye movement sleep, and non-REM sleep and REM sleep, usually considered essential to the restoration and recovery of vital bodily and mental function. This is all the words used here are important to describe sleep. Now, getting enough sleep isn't just about the total number of hours. It is also important to get quality, good quality sleep on a regular schedule so you feel rested when you wake up. If you often have trouble sleeping, or if you often still feel tired after sleeping, your sleep might not be optimal, even though you might be sleeping for long hours. Now, this is a chart by the National Sleep Foundation, and you can see that sleep requirement can vary as per age, different phases of our lives, and the normal range can vary from up to 4 hours. So you can see, for example, in infants, it can vary from 12 to 16 hours. So it can be an individualized requirement for sleep. Sleep, as we all know. So first of all, here I would like to say that in Ayurveda, 5,000 years ago, the importance of sleep was established as Ahara, Nidra, Brahmacharya as the 3 upastambhas of health. After the 3 stambhas, which are Vata, Pitta, Kapha, the 3 doshas. However, in Western medicine, I think we all are very well aware that the importance of sleep was acknowledged, I think, just barely 30 years ago. I think all of you will agree that when we were students, there were no sleep labs. There were no sleep studies. Those things have started only 25 years ago, barely, because the Western medicine is now catching up with the value of sleep. And I'm aware of just about 10, 15 years here in the area where I live. It's a mecca of medicine, Western medicine, Boston area. And here I'm aware of certain researchers who have done now, in the past decade or so, extensive research on sleep and its impact on things that were not correlated to sleep, even 20 years ago, like immunity. Now, immunity has been linked directly to the quality and quantity of sleep. So many such things are being discovered by the Western medicine studies, whereas in Ayurveda, Ahara, Nidra, Brahmacharya, they have been equated equally. Nidra is equal to Ahara. It has been given that much centrality, that much importance. So going back to the slide deck, so you can see sleep plays a vital role in good health and well-being throughout life. So when we look at the second line of our definition of health, Prasanna Atmendriya Manaha, you will feel prasanna if you have slept properly and well. And that prasanna state is disturbed if you have not slept well. So it does interfere with your basic definition of health. Getting enough quality sleep at right times can help protect your mental health, physical health, quality of life, and safety. We'll see in a minute how it affects safety. So not just physical health and well-being, but mental health and well-being. The way you feel while you're awake depends in part on what happens while you're sleeping. During sleep, your body is working to support healthy brain function and maintain your physical health. In children and teens, sleep also helps support growth and development. This is very important. If children are not sleeping properly, their growth and development, their neuronal development, their physical development and growth, all these can be impacted. And we all know, see, the thing is that what I wanted to highlight from my end is that in our clinical practice, we are paying attention to many things. What are you eating? Are you exercising or not? But often we are not paying enough attention to sleep. we have forgotten that sleep is one of the upastambhas of health. So in today's world, as Dr. I think Agnihotri ji was saying, that sleep is quite impacted. The quality of sleep, and especially in the younger generation, because of the way the education system is, even young kids are being put in some kind of Montessori or something, and 2-year-olds, 3-year-olds, mother or father are waking them up. Get up, bus is coming and you have to go to school. That is the way our education system is. So our next generation, our youth, are constantly sleep deprived. I think all of you will appreciate this, that the sleep debt starts very early. And we often overlook that. When we are looking at our patients, we often forget that there could be a huge sleep debt that could be contributing to their mental health issues, their physical health issues, their physiological health issues. So that is something we must again spotlight and highlight for ourselves as clinicians. So the damage from deep sleep deficiency can occur in an instant. This is what the safety part was, that car crash, factory accidents, worker accidents can happen due to chronic sleep deprivation. And ongoing sleep deficiency can also raise your risk for some chronic health problems. It can also affect how well you think, your executive functioning, your responses, your sharpness, your focus, your attention, your recall. All of these can be impacted by lack of sleep. Sleep helps the brain work properly. While we are sleeping, brain is preparing for the next day. So even something which is a machine, our laptop, we snooze it, we switch it off. So our switching off happens. Brain is our computer, our processing part of our body and executive organ. So that also needs to rest and to restore. So while we are sleeping, brain is resting and preparing for the next day. It's forming new pathways to help you learn and remember information. Studies show that good night's sleep improves learning, whether it's simple learning or special skills like piano, etc., or problem solving. So all of these higher learnings can be improved if the sleep is good. Sleep can also help you pay proper attention, make decisions, and also be creative. Studies show that sleep deficiency alters activity in some parts of the brain. If you are sleep deficient, you may have trouble making decisions, solve problems, control emotions, and cope with change. Sleep deficiency has been directly linked to depression, suicide, and risk-taking behavior. Children and teens who are sleep deficient may have problems getting along with others. So social interactions may also be impacted. When we designate or identify someone, children or a youth as moody, or reactive, it could actually be linked to their sleep deficiency. It's not that they are trying to be troublemakers. So we have to dig deeper. We have to follow darshana sparshana prashnehi. So we have to question in the right direction to get the right information so that you can do the nidana properly, because the first step of the treatment is nidana parivarchana. So I have seen in my practice that even some of the migraine patients, when I investigated deeply, it turned out that they were really having chronic sleep debt. And once I helped them understand that you probably just need to sleep to get rid of your migraine. Of course, I helped with some herbs also, but the Nidana Parivarjana was very important. So even something like migraine was helped or resolved with just simple recommendations to sleep better, to sleep in time, and to have a rhythm in sleeping. So sleep deficiency can lead to anger, impulsivity, mood swings, sadness, depression, lack of motivation, etc. Attention also can be impacted and grades can be impacted. Sleep plays an important part in your physical health. For example, The healing and repair of your heart and blood vessels happens when you sleep. Ongoing sleep deficiency is linked to increased risk of heart disease, kidney disease, high blood pressure, diabetes, and stroke. And obesity, we all know that 10 to 2 is pitta time of the night, and most of the youth are awake at that time these days. They like to remain awake, they like to sleep late, and therefore they end up eating more. And also their insulin mechanism behaves differently if they are not asleep at that time of the night. So obesity is also being linked to improper sleep habits. So insulin regulation, sugar regulation, growth and development, growth hormone regulation, etc. are directly linked to proper sleep. Puberty and fertility, immunity, and resistance to diseases in general is linked to sleep. I'm just going fast so that I'm able to cover the rest of the PowerPoint. Safety, as I have already mentioned, and even a loss of just 1 to 2 hours of sleep per night can lead to chronic sleep debt. Lack of sleep also may lead to something called micro sleep. So micro sleep happens when you're awake. So like in the class, you're trying to remain awake, but you have already zoned out, you have fallen asleep and you don't even realize. And if it happens on a machine or while you're driving, that can lead to accidents, fatalities. You can't control micro sleep, and you might not even be aware of it. This is what happens when you have accidents because of drivers that slept on the way. So daytime performance and safety are also impacted, not just the nighttime. So many things can make it harder for you to sleep. You have to get to the root of the problem: stress or anxiety, pain. Pain can be a very simple thing that can interfere with regular sleep. Heartburn. People who have reflux are not able to sleep straight without getting this reflux, so it disturbs their normal sleep pattern. Some medicines can be stimulating. Caffeine, obviously, very straightforward. Alcohol and other drugs. Untreated sleep disorders like sleep apnea, where a person might not be able to breathe and might wake up suddenly to gasp for oxygen. So that also can interfere with the continued sleep. So I'm not going to go over the sleep disorders. Now we're going to talk about sleep in Ayurveda. I think this, we are all from the Ayurveda fraternity. We all know the different definitions of Nidra. And these are the 3 Upastambhas. So here also you see 5,000 years ago, happiness, misery, nourishment, emaciation, strength, weakness, virility, sterility, knowledge, ignorance, life and death. All of these are a function of the quality of sleep. Proper diet, proper sleep is also very essential. This has been mentioned 5,000 years ago, so we really must appreciate that. Optimal sleep brings about happiness and longevity in human beings. Sleeping and awakening in right and balanced quantity and quality proceeds an individual towards happiness. So again, this is just in a nutshell: Sukha, Pushti, Bala, Vrishta, Jnanam, Jivitam. All of these are a function of good sleep, good quality and quantity, both. And abnormal sleep, on the other hand, will lead to Dukkha, Karshyam, Abalam, Klibata, Ajnanam, Ajivitam. Causes of insomnia. Common causes: fear, worry, anxiety, anger, smoking. If you're angry at someone, you will find yourself to be unable to sleep. If you have a stress, any type of stress, emotional stress, relationship stress, financial stress, any other type of stress, you will find yourself to be unable to sleep. Smoking can lead to stimulation, and that also can interfere with sleep. If you exercise too much, you might aggravate vata. After all, we know nidra kapha tamo bhava. So we do need some rise in the kapha. That is why it is best to sleep 6 p.m. to 10 p.m. That is the kapha period of the night. So that is the ideal time to go to sleep. Fasting and exercise can aggravate vata and therefore can interfere with this nidra kapha tamo bhava physiology. Excessive colon cleansing. So if apana vayu is overactive. Uncomfortable bed, very simple. Just the bed is not comfortable. That can also lead to interference in sleep. Body pain, feeling of heaviness in the head, frequent yawning, stiffness of the body, discomfort, bloating, distension of abdomen. Any type of discomfort anywhere can lead to interference in sleep. Simple steps for an optimal sleep experience. What can we do? So try to spend some time outdoors every day. This is very important so that you are getting aligned with the sun cycle, circadian rhythm. When it is bright, you are awake, you're active. When it is dark, sunset, you also should be creating tama around you. Nidra, kapha, tamo, vava, not just internal tamas, but externally, switch off lights, switch off gadgets. So you have to create that environment. Plan your physical activity earlier in the day. Stay away from caffeine, especially later in the day. If you are used to napping, limit that. Alcohol, any other stimulant should be avoided. Don't eat a big meal close to bedtime. These are all from Ayurvedic classic texts. If you smoke, make a plan to quit or at least minimize. Make sure your bedroom is dark. This is what I meant, that tamas has to be created externally also. If there are street lights near the window, try putting up light blocking curtains. Keep your bedroom quiet. Consider keeping electronic devices outside of your room. If they're inside, at least switch, means minimize your screen time. Avoid eating, talking on the phone, go to bed at the same time. So there is something, some merit in getting into a sleep ritual. And here we call it also sleep hygiene. What time you're going to sleep, designate it, start to get into your night dress, brush, etc. half an hour before that, keep the gadgets out. These are part of the sleep hygiene practices. If you're still awake after staying in bed for more than 20 minutes, get up and do something relaxing, like reading or meditating until you feel sleepy. All of these can help with inducing sleep. Body and or head massage, application of different types of herb paste on the forehead, hot water bath, again it mitigates vata. Drink soup of fatty animals and birds, increases kapha. Eat rice with curd, abhishandi, guru, so brings on sleep. Drink warm buffalo milk, consume ghee, drink herbal alcohols, any type, ashwagandha rist or anything that can induce sleep. Listen to soothing music, songs or talks. Have someone press your feet or other body parts. Bed should be pleasant, clean and comfortable. House should be pleasant, clean and quiet. Here are some of the herbs that can help: ashwagandha, tagar, shankapushpi, jaifal, jatamansi, kadali faladi oil. These are just a very small example. Now, this is the last slide. These are the interesting sleep trivia. Although sleeping during the day is discouraged, taking a small nap while sitting or just 45 degrees is considered harmless. In fact, it can be invigorating. If one has remained awake, this is very important, this is special. If one has remained much beyond their normal bedtime, they should skip breakfast and sleep half the number of hours of which sleep was missed. This is mentioned in, I believe, Charak Samhita or Ashtang Sangraha. I was very fascinated when I had made this PowerPoint, and I remembered from my school days also, I mean, BAMS days, that if you have missed, let's say, 6 hours of sleep in night or 4 hours of sleep, you need to make up with only 2 hours of daytime sleep. This is very fascinating formula. Sleep is recommended as one of the modes of treating emaciation, karsham. So that's all from me. This is just a quick overview. Any questions? I'm happy to take, although I know probably we have other speakers that need to also talk.
Thank you. Thank you. Excellent. Excellent, madam. You have everything covered. Everything covered. Excellent. Great. We would like to welcome you again and again.
Thank you so much.
We would like to welcome you again and again on different topics of your choice. Thank you. Thank you very much. So nice.
Thank you so much. Thank you. I will just share my contact info in chat, and I will listen to the next speaker and drop off at some time.
Right, right. Very right. Agnihotri ji, would you like to say something?
Yes, sure. Namaskar. Dhanyavad. First of all, Dr. Pratibha Shah being Indian, I would like to greet for our holy festival. Though any person of any country should be greeted for all the seasons, regions, and festivals. Dr. Pratibha Shah is also been close to us, and she needs real short of appreciation as she took all pains to deliver her lecture. Even she has got an extraction of tooth on 2 days before. So it's a real cooperation and commitment for the cause of our webinar. Well, she touched all the areas where the sleep concept can be detected. May it be Western sciences, may it be Ayurvedic sciences of say 5,000 years back. Very importantly, she also talked about the Upasthama, and as far the treatment is concerned, she talked for the causes of the sleeplessness. They should be removed along with some of the treatment part. In India, and especially in our text, in our civilization, we are being advised even when to sleep. What are the seasons for daytime sleep, or what are the dates where sleep is avoided? Like today, as Dr. Pavanashamai told in the started itself that today should not be sleep because of so many reasons. But on tomorrow onwards, it will be a normal. But my view, my submission is this: that on Pratipada date or Pratipada Tithi, day sleeping is avoided. The very important point is, so my father used to say, होली कर लिया, खेल लिया, थक गए, कुछ भी हो, सोना नहीं है, प्रतिपदा को सोते नहीं है, प्रतिपदा को सोता नहीं है, वही अन्नकूट वाले दिन में यही कहते थे. So from that angle also, one is supposed to be remain awakened during daytime. So very good submission, and rest we will conclude in after minutes. But as she has to leave, so I would like to submit these a few words of appreciation. Thank you, Madam.
Thank you, Agnihotri ji. I would like to request Dr. Harish Verma ji, as she has to leave, if he would like to say anything. Dr. Harish Verma from Toronto, Canada. Welcome, sir.
नमस्कार पवन जी और सभी आचार्यों को प्रणाम. डॉक्टर प्रतिभा जी नमस्कार.
नमस्कार.
थोड़ा आप अपना एक्सपीरियंस भी शेयर करें कि जो आयुर्वेदा में शिरोधारा है, इसका कोई रोल है स्लीप थेरेपी में?
100% हरीश जी, ये तो मतलब बिल्कुल तय बात है. बहुत डीप इम्पैक्ट होता है शिरोधारा का, और सबसे बढ़िया बात है कि ऑन गोइंग इम्पैक्ट रहता है. एक शिरोधारा के बाद कई दिन तक उसका बेनिफिट मिलता रहता है. और इस पे मेरे ख्याल से यहीं पे नहीं, यहाँ पे नहीं, आई थिंक एक स्टडी यहाँ पे करी थी डॉक्टर विंजमुरी ने, वेस्ट कोस्ट के, हमारे यूएस के, और उसका उन्होंने डॉक्यूमेंटेशन किया था इन टर्म्स ऑफ ब्रेन वेव्स में क्या चेंजेस आए उसके बाद. तो इट इज अ वेल डॉक्यूमेंटेड impact of Shirodhara on sleep quality.
Thank you, Dr. Pratibha ji. In this, one case is remembered, told by my father. My father was first batch HPA from Jamnagar. From there, I did my MD in 1989 under Professor Hari Shankar Sharma ji. So we, father and son, both are from one institute. So he remembered, and he again and again communicated me that Professor Kurup was there in Jamnagar as head of the department Panchkarm. At that time, Sri Nehru ji, our Prime Minister, faced some problem of deep anxiety or sleeplessness. Their modern doctors did not allow to intervene internally. Only option was left that externally you can do anything. So by Shirodhara, Nehru ji got relieved. This was the version of my father, and I hope this was the confidence of Ayurveda that our Prime Minister also at that time got relieved by Shirodhara, in anxiety and sleeplessness. And then after that, Dr. Kurup was transferred to BHU, and then he got very good administrative post also. So this was the case. Shirodhara is really impressive and effective in Nidra. But unfortunately, it is not the tool which can be practiced in house by own. Somebody is needed there. So this is my opinion.
If I can say, Pavanji, one thing that I was just about to say the same thing, that Shiro, especially in the West, we don't get trained workers, body workers. We don't have very, these kind of availability. So what we have, what as a practitioner, I find very useful is Shiro Abhyanga and Shiro Pichu, because that the patient can do themselves. So this Kadale Faladi Tailam, Chempurti Adi Tailam, these are available here. Since past 4-5 years, Kotekal is vending out of New Jersey, and this they can do. So we teach our patients to do it themselves. But I also work, luckily in my area, there is a trained body worker, Aparna Joshi, and I work with her for all kinds of bastis, Janu Basti, Griva Basti, and Shiro Dhara, and other kinds of body work treatments. But you're absolutely right. On a daily basis, the Pada Bhyanga, Shiro Bhyanga, and Shiro Pichu is very easily doable by the patient themselves.
Thanks for your communication. I hope Dr. Harish Barmaji is also satisfied with the answer. Harish sir?
पवन जी, एक क्वेश्चन था, और हम थोड़े दिन पहले एक वेबिनार में एक एक्सपर्ट आए थे, तो उन्होंने कहा कि शिरोधारा में जो थेरेपी का जो टेक्निक है ये मैटर करता है. इट डजंट मैटर कि उसमें जो लिक्विड यूज होता है, चाहे वो ऑयल है, चाहे वो तकर है या चाहे वो कषाय है, वो मैटर नहीं करता. तो इसमें डॉक्टर प्रतिभा जी, आप भी अपना सजेशन दें कि इसमें ट्रुथ क्या है या आपकी फाइंडिंग्स क्या है.
हरीश जी, बिल्कुल जो मीडियम है वो 100% मैटर करता है कि आप तेल में भी आप कौन सा तेल यूज कर रहे हैं, वो मैटर करता है. आप तक्र यूज कर रहे हैं या क्षीर यूज कर रहे हैं या कषाय यूज कर रहे हैं, वो कम यूज होता है बट यूज होता है. तो उनके गुणों के हिसाब से, जैसे अगर किसी को बहुत ज्यादा कफ वृद्धि है या तमस वृद्धि हम अगर मान ले, तो उसमें तक्रधारा बहुत बढ़िया काम करता है. वो उसको डिस्पर्स करता है. और टेक्निक तो बहुत ही इंपॉर्टेंट है. मैंने यहाँ पे काफी लोगों को देखा है, बस वो लोटा ले लेते हैं और बेड ले लेते हैं. अब वो पता चला कि हाइट ज्यादा है, काफी ऊपर से हो रहा है, तो वो शांत करने की बजाय वो इरिटेट करता है. तो वो सब देख के बड़ा दुख लगता है. और तीसरी बात यह है कि टेम्परेचर बड़ा इंपॉर्टेंट है. कई लोग यहाँ पे, मैंने जब शुरू में एक गोरी लड़की के साथ मैंने काम किया, तो उसने कहा मेरे को मैं ट्रेंड हूँ शिरोधारा में, तो मैंने कभी मैं बिना आपका काम देखे मैं अपने क्लाइंट्स को आपके पास नहीं भेज सकती. मैं गई देखने, तो वो गर्म था तेल. तो उनको बताना पड़ा कि भाई आप ये गर्म नहीं कर सकते, आप ये पूरे एरिया में गर्म नहीं कर सकते. ठिरमिरा हो सकता है, गुनगुना हो सकता है, लेकिन गर्म नहीं हो सकता. तो वो सारी बातें हैं कि हर चीज मैटर करती है. 100% इट मैटर्स कि आप तक्र से कर रहे हैं कि आप तेल से कर रहे हैं, और तेल में भी कौन सा आप इस्तेमाल कर रहे हैं, बिल्कुल मैटर करता है, क्योंकि उनके गुण बिल्कुल अलग हैं.
मैडम नमस्कार.
थोड़े दिन पहले एक मॉडर्न मेडिसिन के डॉक्टर हमारे वेबिनार में आए थे, इसी वेबिनार में पवन जी के. तो उन्होंने अपना एक्सपीरियंस कहा कि हम तो एक एक ड्रॉप डालते हैं. मैं बड़ा हैरान था कि ड्रॉप डालने से क्या फायदा होगा, जबकि आयुर्वेद के ग्रंथों में तो धारा का जिक्र आता है कि इन द फॉर्म ऑफ स्ट्रीम वो लिक्विड आना चाहिए. तो फिर मैंने एनीवे बट ये बड़ा अच्छा लगा आज. डॉक्टर प्रतिभा जी नमस्कार. थैंक यू.
नमस्कार.
एक
बात और कि वो कितना पतला है और कितना मोटा है, वो भी मैटर करता है एक्चुअली. सॉरी. हाँ जी सर.
डॉक्टर हरीश शर्मा जी ना, आप शायद डॉक्टर अवधेश पांडे जी के जिक्र कर रहे हैं, जो रेडियो डायग्नोस्टिक्स के डॉक्टर साहब आते हैं. जी. उन्होंने बताया था कि जो शिरोधारा में वो ड्रॉप बाय ड्रॉप डालते हैं, स्पेशली आगे चक्र पर पिनियल को ग्लैंड को स्टिमुलेट करने के लिए इन ए फॉर्म ऑफ वाइब्रेशंस. and at the same time they also ask to the patient to just count the drops. Not only that, go for the internal chanting of the mantras. So his approach is entirely different, with a special reference to the mental upliftment and all that. But the dropping, shaping in a form of dropping of Shirodhara concept is a question. So in that way, if you can, consistency, viscosity, temperature, these are the decoctions and articles are used. These are the different questions. But the idea is that instead of installation of the drops or instead of the steam itself, what is preferable with its beneficial effects?
दोनों का अलग अलग इफेक्ट है सर. एक जो टोटका बताया जाता है सोने के लिए, टू स्लीप, प्लीज काउंट from 100 to 1. So that is also there. 99, 98. So people, person is focused to count that.
Yeah.
That is a separate issue. And
That is also
reminded good subject that chanting of mantra.
Yeah,
that is also
in
good.
This concept is hidden in between the processing.
Yes.
Under the process,
and the best example of Shirodhara is Mahashiv, Sadashiv. Every time Shirodhara is going on Shivling, every time. So Shirodhara is for relaxation of mind. That is clear. Excellent. Excellent, Dr. Pratibha ji. Thank you, Dr. Harish ji, for questioning, and Agnihotri sir. Welcome. Thank you very much, madam. So now I would like to request Professor Vineetha V. Kurup, Associate Professor, Department of Samhita and Siddhanta, JS Ayurveda Mahavidyalaya, NADIAD. Welcome, madam. Welcome.
Thank you.
I am really thankful to you all, you,
Namaskar.
Pratibha ji, Bishnupriya ji, and Priyadarshanee ji. Excellent, madam, to bless this platform. Welcome.
Sir, thanks a lot for giving me this opportunity. And first of all, a very happy Holi to all the dignitaries in front of me, especially Agnihotri sir, Harish Verma sir, Bishnupriya madam, Pratibha madam, Gunarathne madam. And I'm very thankful to all the organizers who are taking the initiative to conduct such a very wonderful program. And I think I know there is no need of much of introduction, and we will directly move on to the slides. Please let me share the slides first.
You can.
Yes. I hope my slides are visible. Okay. So sleep.
You can go for slide.
Yes, sir. Yes. Sir, is it visible? I hope my slides are
Visible. It is visible, but in PowerPoint mode. Kindly go for slideshow to maximize.
okay, sir. Yes. Okay, sir. So let me tell all the details in detail and in depth. Pratibha madam has already discussed, but still, let me tell you from the beginning about the basics of Nidra. Nidra, actually, the definition of Nidra, it is more promptly given by Acharya Harita. So he says, Deham Visramate Yasmat Tasmat Nidra Prakirtita. So the time taken by the body to rest.
Your
itself.
slides are
So
not
that is-
moving.
Slides are not moving, and
okay.
Go for slideshow.
Yes, sir. Okay. Okay, sir. Okay.
Your PowerPoint is visible, but slide size is mini.
Okay.
Thank you.
Sir, is it okay now?
No.
no, not yet.
Let me stop and share it again.
Slideshow from down.
Yes, okay.
प्यारा का टुकड़ा दे दो की दो दे दे अरे
I hope, so we will start with about the definition of Nidra. Acharya Harita says the definition of
madam, not
Nidra
yet.
very accurately.
Not here is moving.
Oh.
Yes.
I hope
Now
it's
it's okay.
fair now, sir.
Yes.
Okay. So let's see what Nidra is. When we see the Ayurvedic classics, we find a very prompt definition of Nidra, which is given by, beautifully given by Acharya Harita. He says, Deham Vishramate Yasmat Tasmat Nidra Prakirtita. So Nidra is one where the body is taking the time to rest, or it is the time for rest for the body itself. And we know that it is not only for the body, it is also for our mind. And we also consider the Nidra, the definition of Nidra, which is given by the modern concept, a condition of the body and mind that typically reoccurs for several hours every night, in which the eyes are closed, the postural muscles are relaxed, and the activity of the brain is altered. And lastly, the consciousness of the surroundings are practically suspended. So this is what Nidra is actually. It is a group of events, so and so, and that is called as Nidra. So when we say Nidra, it is, actually my slides are not moving. My network is so poor today, so I hope because of that. So Nidra. So when we say more about Nidra, Nidra is actually explained as two major entities in the Ayurvedic classics. So first one, that Pratibha madam has already discussed, that it is one of the Upastambha. So this stambha, that is the pillar which holds our life or our body. Those are three: Traya Upastambha, Ahara, Shayana or Nidra, as well as Abrahmacharya. So in this, Nidra is one. And it is also considered as a Vega. So that which is coming into us very cyclically or periodically, and that which is inevitable. So that is considered as Nidra. So we consider Nidra as one of the Upastambha as well as one of the Vega. So before we go into the details of Nidra, I think the few questions to be discussed for a while regarding the Nidra. So such questions like when to sleep, how to sleep, how much to sleep, etc. So we will see each one. When to sleep. So usually it is a very simpler question when we see the question. So it is usually understood that we sleep at night. And this is what the physiology of Nidra is. And usually we sleep at night, and it is usually, or it is found that it is controlled by two things. One is the circadian rhythms. So I think the name has quoted by Pratibha madam always also. Circadian rhythm. And the second one is, it's like the controlled by the melatonin, the hormone which is inside our body. And we also might have heard or aware about the biological clock which maintains the regular activities which is performed in our body. So because of all these cyclical events or mechanisms, the sleep is always regulated to be during the night times. Next is how to sleep. So when we sleep, when we say about sleep, the position of the sleep is very important. So usually it is usually in the lying down position with your back or the spine is straight, by keeping this spine straight. That is considered as the ideal position to sleep. Or else we can sleep on either sides, either in the left lateral or as well as in the right lateral. Next is how much to sleep. So that is also, madam has already discussed, based on the age, starting from a newborn infant to an adult. So the time for sleep it changes. So for a newborn, it may be around 17 to 20 hours. The newborn baby need to get asleep. But when we come to the adulthood, an adult human, it is believed that we need a sleep of 6 to 8 hours per day. So this is how much we should sleep. Next is very few things which are very specially explained in our classics, whom all should sleep and whom all should not sleep. In Charaka Samhita as well as in Ashtanga Hridaya, there are explanations that whom all should sleep. किसको सोना है, किसको सोना नहीं है, किसको दिन में सोना है, किसको दिन में सोना नहीं है, और किसको रात को भी सोना नहीं है. So all these things are found to be very relevant when we see our classics. So whom all should sleep. So we say like all can sleep during the night times. So we will come to the day sleep later. So next is whom all should not sleep. So it is told some people who are having some specific diseases, like some of the Visha Roga. So they are, it is considered as, it is told like Visha and Vishartha as well as Kantharogi. Those who are having the diseases which are affected to the body because of administration of any type of Visha, poison, any type of poisoning, there the person should not sleep. And also one more thing, it is Kantharoga, that is any diseases which are related to our throat or the above clavicular region, that person is also, it is contraindicated for sleeping. Coming to whether day sleep is good. So really, day sleep is not good. But there are few instances in our classics where Acharya told we can do day sleep. So very importantly, it is the Grishma Ritu. So the summer, hot summer, it is told we can sleep for a while during the day. And for that also, Acharya has specified it is better to do the asina prachalayitam. So it is told by not lying down and sleeping, it is in a semi-sleeping position. So that we can take a nap. It is, we cannot say that it is a sleep. We can just say it is a nap. We can nap, we can take a little of nap during the Grishma Ritu. So that is the specification of Grishma Ritu. That's why the Acharya, all the Acharyas, especially the Brihatrai, Charaka Samhita, Shushruta Samhita and Ashtanga Sangara as well as Hridaya, specify that we should take a little bit of sleep during the Grishma Ritu. Then it is for whom? That is for the person who are living or going through the Grishma Ritu. Next is the important part. It is what are the benefits of ideal sleep. It is like a very importantly, Acharya have told line by line, like Nidrayatam, Sukham, Dukkham, Pushti, Kashyam, Balabalam, Vrshata, Klebada, Jnanam, Ajnanam, Jivitam, Nacha. So it is like all the Sukha, Dukkha, Jnana, Ajnana, and even the Jivita, that is life itself, is based on the Nidra. So we should take an appropriate care as well as an appropriate measures if we have an improper sleep. So all these shows the importance of Nidra. So next is, what is sleeplessness? Today's topic, Nidra Nasham. Sleeplessness is also known as insomnia. It's a sleeping disorder in which people have trouble in sleeping. So we have many sleeping disorders like insomnia, like narcolepsy, like some of the introductions Madam has already given. So we don't give into the details of all those things because we have a shortage of time. So Nidra Nasha is something which we have to understand like trouble in sleeping. So that may be in different type, like it may be having a difficulty in falling asleep or staying asleep for a long time. So anything it may be. So all those are considered as Nidra Nasha. The prevalence of sleep. So this is seems to be very important in today's life, because in general population, around 20 to 41.7% of people have suffering from the sleeping disorders. So this is like more than around half of the people. So this is the significance of what we need to learn more about the Nidra. And especially in the US, the adults, around 50 to 70 million people have lack of sleep. And also it is told currently as many as of 1 out of 6 adults use some sleeping aids So this is also very important. So it's a huge figure. So when we see 1 person out of 6 who are using some sleeping aids to get a normal sleep, that's a huge number. So this is what all the importance of sleep which shows. We will see what are the simpler remedies which is considered as very much effective during the disease or the disorders of sleeplessness. Especially, as Madam told, all these remedies based on the age or the person, the severity of the sleeplessness, as well as the mode of the therapy which is indicated. We know because the therapies like Panchakarma, Vamana, Virechana, Basti, Nasya, Rakta, Mokshana, Adi, we have many indications and contraindications. We should always think about the contraindications and the people who are suffering from multiple diseases. Along with sleeplessness, always some of these other diseases may be associated. So in such cases, we always have to think about the contraindications and we should avoid logically the things which are contraindicated, and whichever is suitable for the person, we should select and advocate. When we see the treatments in Ayurveda, usually we divide the treatments of Ayurveda into 2. It is Shamana as well as Shodhana. Samana is something which we say like a pacifying treatment, where the doshas are subsided in the body itself. And on the other hand, where in Shodhana, the increased doshas are expelled out of the body. So we will see what are the Shamana medicines, especially, which is explained by Vagbhata. So like the materials or the dravyas like milk, alcohol, dadhi, curd, as well as meat soup, etc. are to be practiced daily so that we can reduce our vata dosha. We can do the shamana of our vata pitta dosha and we can maintain a good sleep. So these are considered as some of the shamana or some of the things. So it is told by Acharya Shilayen Manda Nidrastu Shira Madhya Rasan Didhi. So these are the few things which we can advise. So like ma'am told, apart from in any other country other than India, there is lack of manpower when we speak about Ayurveda. So there we can advise people to have a habit of drinking milk at night, have a habit of taking meat soup, have a habit of taking dadhi, that is curd, yogurt, etc. Coming to the other part of treatment, the Shodhana, where we need more of manpower, some measures, some of the therapies like to assess the treatments which we cannot do it in the home, or it's not household treatments. So there the treatments like Abhyanga, Udvartana, Snanam, Murdha Tarpanam, Karna Tarpana and Akshi Tarpana are specially advocated for the therapies for sleeplessness. So from the next slide onwards, I would like to share some of the videos which are which are practiced in day to day. So this is what Abhyanga is. So this is what Abhyanga is. It is definitely Vataharam. We select some of the specific taila based on the dosha predominance of the patient, and thereafter we make it little lukewarm, and it is to be applied gently to the body, whole body, including head as well as the legs as well as in the ears, specifically to all parts of the body. Especially it is done in 8 different postures like sitting, lying down supine, left lateral, then again supine, then right lateral, then prone, then coming to supine, and lastly to the sitting. So this is what Abhyanga is. So see, there are few areas like Shiras Shravana Padeshu Tam Visheshena Shile. There are few areas like in the body like Shiraha, that is head, Shravana, the ears, as well as in the Pada, where we need to do Abhyanga very specifically or specially. So this is what the different postures of Abhyanga are. So the person is kept in the sitting, then in the lying down supine, then left lateral, right lateral, and it is to be done with our palms gently by applying medium pressure. So this is what Abhyanga is. the joints are specifically massaged so that it is usually massaged in a circular way in the joints, and this is what Abhyanga is. Coming to Udvartana. Udvartana is considered as the powder massage. So it is considered as the Kapha Medohara. So the powder is taken according to the suitability of the patient, and the powder is made little hot, and it is specifically massaged in the direction which is opposite to the direction of our our Romakupas, like our hair follicles. So this is what specifically Udvartana is. For both Abhyanga and Udvartana, we usually do by using two assistants, two masseurs. Coming to Shirobasti. So we have, Madam has discussed about the Shirodhara. More than Shirodhara, Shirobasti is also as equivalent to Shirodhara. We can say Shirobasti is also very much effective while doing the treatment for Nidramasha. So Shirobasti is considered a little more hectic treatment than that of the Shirodhara. So as a Purva Karma of Shirodhara, we do the Jatrurdva Svedana, and a cap-like thing is made around the head. So we use leather or rexin, and it is to be tied tightly around the circumference of head. Make sure that we have to exclude our ears so that the oil which we pour inside that must not leak to our body, and it is strictly under the observation or guidance of a medical officer. And the oil, according to the disease or according to the person's dosha, is selected, and it is made lukewarm, and it is to be poured gently, and after keeping for specific time, it is to be taken out by using the gauze piece. And lastly, the cap is removed. So this is what Shirobasti is. Next is about Akshi Tarpana. So Tarpana is a procedure for a medication which is done for the eyes, Akshi Tarpana. So in this, we make this Vedana of the Jatrurdva. As usual, it is considered as one of the Purva Karma of the Akshi Tarpana. The powder of Masha, that is Bengal gram, is taken, and it is made into a tuff, and it is made as a well around the eyes, both of the eyes, and it is to be sealed properly, and the lukewarm grita, usually we use grita, it is made lukewarm and it is poured gently to the eyes, and the patient is asked to blink his or her eyes after completion of the pouring. It is to be kept for the specific time. See, the person is blinking the eyes. So this is about Akshi Tarpana. So these are few procedures we do practically in our hospitals. Coming to the Shamana Aushadhis. This is first we have discussed about the things which we can follow at our home, like habituation of milk, habituation of curd, meat soup, etc. So these are some of the medicines which we can give if the person is having a sleeplessness or nidramasha. See, all the Vatahara as well as Vata Pittahara drugs works good in sleeplessness, like the few are very important or very specific, and they show wonderful results, like Drakshadi Kashayam. There is no question of Drakshadi Kashayam, how does it work. It's definitely 100% works on the Nidra Nasha. It is a best Vata Pittahara, Drakshadi Kashayam, Dhanvandaram Kashayam, Lagu Vanjamulam Kashayam, especially the Kshira Bala Tailam. Then Kshirabala Avarti, any of the Avartis, either it is a 7 Avarti, then it may be 21 or 41, or it is 101. It is administered internally. The person is advised to take 3 or 4 drops of Kshirabala Avarti internally before going to bed. Shows a very wonderful result. Then the Grita, like the Shamula Gritam, Dhanvandaram Gulika, Gurujanadi Gulika, etc., are seen to be very much effective in the therapy of sleeplessness. And lastly, and most importantly, Acharya says, Mano Anukula Vishaya Kamam Nidra Sukhaprada. So like, first of all, what we need for Nidra, for a peaceful sleep, is the feeling of comfortness or happiness. So that we are supposed to bring it to the patient, and we have to console the patient, and we have to give some advices, or we have to make the person's mind calm so that he may feel some kind of comfortness or happiness in his mind or his or her mind, so that the patient can sleep comfortably or peacefully. So this is considered as one of very important. So by this, I think I can stop my presentation here. Once again, I thank Dr. Pawan Kumar Sharma sir and Madan sir for giving me this opportunity. And I think I can stop my presentation here. Thank you, sir.
Thank you very much. Excellent presentation, very different from first speaker.
Sir, your voice.
Awaz, there is some disturbance in the voice.
Yes, sir. पवन सर आपका आवाज ठीक से सुनाई नहीं दे रहे थे.
अभी आ रहा है? जी जी.
Okay, sir.
I would like to communicate my thanks to Dr. Vineetha and would like to request to comment from Dr. Agnihotri ji.
Madam Vineetha, very good evening. Your presentation was very good. First of all, there is a question in chat box that how this Udvartana is helpful in the case of insomnia. So, though it's very clear, but you please define it, and then I'll comment upon your presentation. Hello, you got the question, Madam Vineetha? Hello. Hello.
विनीता जी की आवाज नहीं आ रही है.
हाँ, कुछ फिर कम्युनिकेशन प्रॉब्लम हुआ है. हेलो.
कोई बात नहीं, हम कंटिन्यू करते हैं. Yes.
Now there is a.
Yes, sir.
There is a question in chat box that how this Udvartana karma is helpful in avoiding insomnia or maybe a part of treatment in insomnia. So it's very good because the question is simply as they are using the powder form of the herb, or so always there is whenever there is a massage, it itself say if it is done with the help of the oil also, with the use of the oil also, it subsides the projected or vitiated vata at the seat of its skin itself. That relaxes the muscles and again leads ultimately relaxation to the mind. Resultantly, one may enjoy the sleep. But the effect of the herb powder used in this process is also becomes more and more important, because Udvartan has got so many other ways, like removing the dirt and the say impurities over deposited over the skin. That's a different issue. We use generally for the making the skin shine and make the skin more and more smooth. For the nutrition of skin, it is also used. But for the use of powder in a form of Udvartan, for the use of avoiding insomnia or a part of treatment of insomnia is still a question. Anyway, she referred the case of this insomnia, sorry, the concept of Nidra from Harit Samhita, with the view that Deham is Bismati Ismat Kasmat Nidra Prakirtita. So, Acharya itself, they are also giving very good information, and that covers a lot. That Edatu Manasri Klante Vishebyo Edatu Manasri Klante Karmatma Kalvan Vitaha Vishebyo Nivardante Tada Supiti Manava. So in that way, it covers a more and more process, and that we will talk about afterwards. But very important thing is that till now, though 2 speakers have completed his work, let others complete, then we will continue the discussion on a compilation form. Okay. So over to Pawan Sharma ji.
Thank you, sir. Thank you, sir. Thank you so much. Now I would like to request Dr. K.C. Priyadarshanee Gunarathne ji, our supporter, our well-wisher, our resource person from Sri Lanka. She is having excellent CV, MS in Shalyatantra from SDM College of Ayurveda, and having experience today, she is consultant Ayurveda surgeon, Gampaha Wickramarachchi Ayurveda Teaching Hospital, YAKKALA, Sri Lanka. She was medical officer also. She was demonstrator for Department of Nidhan Chikitsa, Department of Dravya Rasa Bhaisajya Kalpana in GWAI University. She has been awarded with Outstanding Woman Leadership Award in Healthcare and Certificate of Excellence, Sri Lanka. I'm sorry if I am pronouncing wrong. Vanitham Vivana Provincial Competition. Welcome, madam. Without wasting much time, we would like to listen you. Your presentation is with me. If you are unable to present, I can present. Welcome.
I want to all. And I wish all happy holiday, holiday. And I welcome you all, respected dignitaries, for my presentation. Sir, I need to share this. And I like to take this time to convey my sincere thanks to given me this opportunity for this webinar today. So actually, while I am talking, now I am talking not only as a consultant surgeon, but also a psychological counselor around 20 years. With my all experience, I like to share my experience about this topic. So today is the topic best and safe sleep therapy. So this is actually the bird view of my topics. We'll go one by one. So have to move. Then we'll start. Actually, I think that previous two madams also discussed that same things, but still I have to tell all these things because if not, that my flow of the presentation will interrupt. So just I go that physiology of sleep. When the mind gets exhausted, the sensory organs also exhausted. As a result, they detach themselves from their subjects and ultimately the individual falls asleep. Then sleep in night is regular requirement of body and mind. Normally we are thinking it is only need for our body rest, but it is not only body rest, we need that mind rest also. So sleep is involved with mental state, especially brain functions and nervous systems. These all both things have to maintain very nicely for a good sleep. Then reduce normal days time body functions and increase inner metabolic functions will happen during the sleep. So reconstructing an energetic producing process of the body is called sleep. So what is the importance of sleep in Ayurveda? I think already that previous two madams all mentioned it is one of three pillars of life, Upastamba, and one of the Adharaniya Vega, that is Nidra Vega, and special quality of human beings, that means Dharma. In here also they have mentioned Ahara, Nidra, Baya, and Maithun. So please go front, sir. 2 slides. Sir, please go 2 slides front, sir. Front, sir. Next one, sir. Next one, sir. Next one. What happened while sleeping? We have to consider what happened while sleeping in the body. Regulate normal body functions, especially brain functions, maintain metabolism, regulate appetite, enhance immunity, maintain cardiovascular systems. Then reduce respiratory rate, heart rate, limited movements of body, etc. The energy generated in the body during night time deposits in the tissues of the body because we are not using that much energy for the environment functions. So that excess body generated that energy, it will deposit in the tissues. So the growing of the body mostly will happen in the night. Because of that only we are telling, especially for that elders who are sick for a long time and infants, they have to take more sleep at the night. Then what kind of sleeps, actually type of sleeps according to Ayurveda? Then if you talk about the types of normal sleeps, Tamobhava sleep, Shleshma Samudbhava sleep, Agantuka sleep, Vyadya Anuvartini sleep, Ratri Swabhava Prabha sleep, Mana Sharira Shrama Sabhava sleep. Then some abnormal types of sleep, that is Anidra, that reduced sleep, and Atanidra, that is increased sleep. So what are the causes for less night sleep? That means Anidra. Then sometimes some are having habitual for that less sleep because of their day-to-day life and their works, or because of their hobbies, and because of stress and other mental conditions. Sometimes because they had heavy foods in the daytime, also in the night time, and some kind of health conditions. We'll see next day. It is then not given proper time to sleep and awake, because this sleep also a learned behavior. So we have to train our brain to sleep and awake. So we have to give the proper time for sleep and awake. Then irritable, noisy, and stressful side for sleep. That also disturb our mind, and it will prevent the good sleep. Then Vata Kopakara situations, and avoid Nidra Vegas when needed. If you avoid the Nidra Vegas, then brain will learn and it will avoid the normal sleep. Then complications of long-term using some medications. Actually, some medications, they are having complications like sleep problems. So sometimes if they are taking long time, they will suffer insomnia. Some kind of irritating dreams frequently. Some patients, they are telling they are getting sleep, but because of some irritating kind of dreams, they will interrupt their sleep. Then what are the benefits of better night sleep? It is regular sound sleep keeps body healthy, safe, happy, and comfortable. Then weight gain and loss both depend on food and sleep. Then provides nourishment and strength. Enhance person's mental facilities, especially improving concentration. If you need to do very good concentration in your studies or your work, you have to take enough sleep at the night. Then promoting longevity. So you have to go 2 slides front. Front, sir. Then factors of deter better sleep. Yes. Then that is fear, anxiety, anger, like mental conditions. Then smoking, fasting, physical activities before bedtime. Then improper panchakarma done. Then uncomfortable bed, improper bedding. That also very important things to a good sleep. And suppose suppress tamas guna by predominance of sattva guna. Then hectic work schedules, old age, sleeping at odd times, environmental conditions. Then what are the conditions cause sleeplessness in night? These are the medical conditions. They will interrupt the sleep, or it will not giving continuous sleep. Then Sannipata Jwara, Unmada, colicky pain in any place. Then various Vata Roga, Shwasa, Amla Pitta, Vataja Ashtila. Especially because of that Vataja Ashtila, they have to go to washroom frequently. So they have to interrupt their sleep. And in Amla Pitta also, in Kapaja Amla Pitta, they will get severe pain around 2 to 3 a.m. in the morning. So they have to interrupt their sleep. And special conditions just like bedwetting, then wet dreams, walking during sleep, and acid reflux. These are the conditions they will interrupt the good sleep, especially because of that acid reflux. While they are lying on the bed, then they will feel uncomfortability because of acid refluxing. So they are interrupting their sleep. Then problems occur due to day sleep. Shula of the body, Gurutva of the body, loss of digestive strength, heaviness in cardiothoracic region, edema, lack of interest for food, rhinitis, nausea, hemicrania, etc. Then hives, pustules, bodily eruptions, itching, memory impairments, fever, weakness of sensory and motor organs, Shroto Avaroda, and so on. Then what are the day sleep recommended for? That means some people, they need some day sleep because of their body conditions. I think previous two madams also discussed same for elders, students, alcoholics, singers who engage sex in the daytime, excessive physical exercise in the daytime, underweight or emaciated persons suffering from ajirna and has been suffering from injuries. Then weak people, elderly and younger ones, suffering from thirst, colic pain, diarrhea, asthma, chronic respiratory problems, hiccups. Then suffering from mania, who are working in night shifts, who regularly sleeping daytime, and wound patients. Then who need compulsory night sleep, especially patients with heart problems, then viral diseases, for children, for elders, for pregnant women, patients with mental disorders and diseases. Then what kind of herbal aids for natural night sleep? That skull cap flower, then hops flower, valerian roots, gulab, brahmi, shankapushpi, gliosattva, shunti, maricha, pippali, muleti, ashwagandha. They all that herbs we can use either in kashai form or powder form or kwata form or any other form. But this kind of herbs gives very good result for good sleep. Then what are the benefits when we use that herbals? That they nourish brain and nerve systems. Then mild sedatives, grounding and stabilizing. Then gentle and non-toxic. And these herbals give that effects after 4 to 6 weeks of uses. Then what are the good food to eat before bed? Because if you take so heavy and undigested food, it will interrupt the good sleep. So what kind of foods we can take for good sleep? Almonds, they increase sleep regulating hormones, melatonin. Then walnuts increase melatonin hormone. Then kiwi, rich in serotonin and antioxidant, improve sleep quality. Lettuce, calming and substance make drowsy. Then shellfish, especially lobsters and prawns, then tryptophan make sleep. Then white rice, it promote better sleep. Then what kind of drinks good for before bed? That is chamomilla tea, that is antioxidant, promotes sleepiness with calm and relaxed muscles. Then passion flower tea, it is good hour before bed. It is affect the nerves. Then cherry juice, it is fall asleep faster due to increased melatonin. Then milk, tryptophan and melatonin provides soothing backdrop for relaxing bedtime routines. Then suggestions for vata calming. Because of that vata aggravation, we can't go for good sleep. So we have to do that vata calming. For that, we have to use that oil, the body before bed. I think that previous madam has explained very nicely. And gently massage of the body, that soak in warm tub or hot shower or relaxing bath. If you take like this hot bath, that is very good for good sleep. Then drink soup of meat of marshy and aquatic animals. Then take rice with yogurt. The use of milk, ghee in limited amount in diet. Then practice breathing and relaxation more often. Eat whole foods that emphasize warm, cooked with plenty of protein and ample amount of healthy oil. Take herbs that calm and nourish the nerve system. Use favorite scents and perfume. That also giving very good impression to start a good sleep. And listening gentle and calming sounds. Because if you listening very irritable sounds or irritable programs, it will again aggravate the vata. So it will depress the good sleep. Then avoid stressful talks and other activities, especially while we are watching some kind of movies and some kind of documentaries. We are getting stress before the sleep. So it is avoidable thing before sleep. And use soothing ointment on eyes. That also, I think that previous madam has told and shown nice video about that. Then apply cool paste over on head and face. That also, I think madam has explained. Then having comfortable, clean and pleasing sleep. Then go to bed and wake up at same time every day. Earlier also I mentioned that is a learned habit. So we have to give the good message to the brain. This is the time for bed and this is time for the wake up. Then only we are getting very good sleep. Then avoid talking stimulants at least 6 hours before sleep. That means especially caffeine, etc. Then avoid large or heavy meals. You have to take light food before sleep. And exercise vigorously earlier in the day. You can do that exercises, but it is on the daytime, but not before the sleep. And avoid daytime napping. If you take daytime napping as a habit, then it will interrupt your good sleep at the night. Then get adequate exposure to natural lights. Because of that light also, sometimes it will interrupt your sleep and sometimes it's promote your sleep. If you consider about the dosha and the sleep, that vata dosha, you all know that it is composition with vayu and akasha. That is in 6 to 10 p.m. If you sleep in this time, creativity in the daytime, dreaming at night. And if you consider about the pitta, its composition of tejo, that time is in the night time 10 p.m. to 2 a.m. Action, productivity in the daytime and metabolic process in night. And the kapha, its composition of patavi and apo, it's the time 2 to 6 a.m. Then lethargic day or night. Then age and sleep required per day, because according to the age, they will need various time of sleeping hours. So if you consider about the infants, they need 16 to 18 hours. They boost growth and development of the infant. Then schooling age children and teenagers, they need around 9.5 hours per day. And the adults, they need 7 to 9 hours, because age 16 years and above, they are getting light and interrupted and shorter sleep. So they need around 7 to 9 hours sleep to get good health condition and the happy next day. So normal recommended time for good healthy sleep is 10 5 a.m. Then who need to get up some late in the morning? The pregnant woman, then sick persons and kids, they can sleep more than 5 a.m. So the colors also giving some influence for the sleep. If you need good sleep, you have to use dark blue environment, especially for your beddings, then curtains and all your pillowcases and other pictures in your rooms, everything like that. Then green heavy, then violet, yellow, silver, orange, pink. That babies and children, especially they need whitish, blue and yellow. They cooling and lowering the body temperature. Then red and purple colors are not good for sleep because they boost alertness, and the gray and brown, they promote negative emotions. Because of that also, they are not getting good sleep. Especially I want to mention here something. In your bedrooms, don't use that bedrooms for your learning, your studying, or your working other than your sleeping. Because if not, your brain can't understand for what purpose you have come to your room. So if you keep your bedroom for only sleeping, then if you enter this bedroom, you can get very good and nice sleep very easily. The temperature also get giving very good influence for the sleep, especially for adults. They need 60 to 67 Fahrenheit temperature for good sleep. Especially average 67 is the best. Then it is facilitate stability of REM sleep. Then for babies and toddlers, they need somewhat hotter sleep than adults, that is 65 to 70 Fahrenheit, especially average 69 Fahrenheit or 20.5 centigrades. Too hot bedrooms increase the risk of sudden infant death syndrome. Then habits improve the sleep. What kind of habits will improve the sleep? Go to the bed and wake up at the same time each day, especially 10 p.m. to 5 a.m. is the best time. Earlier also I mentioned same. Then exposing to sunlight in the morning and bright light during the day. Then regular exercises around 20 to 30 minutes a day, but not later than few hours before bed. That's what especially I mentioned earlier also. You have to do your regular exercise before bedtime, mainly in the daytime. Then dinner at least by 7 p.m. because you have to go to the bed with digested food in the stomach. So you have to take at least dinner 3 hours before your sleep. Then comfortable mattress and pillows. That also influence of your sleep. If that mattress is not comfortable and the pillows also too hard, then it will interrupt your sleep. Then a warm bath in night and reading pleasant things, listening to soft music. The thing is, all these things you have to do outside of your bedroom. And once you get your sleep nicely and feeling of sleepy, at that time only you have to go to the bed for sleep. Then relaxation, yoga, meditation before bed. Then soft, relaxed, fresh night clothes. That also influence in your sleep, because if you're not taking relaxed and fresh night clothes, it also gives that good light impression for your mind and body. So you have to consider about that also. Then if you're having any problems that interrupt your good sleep, then you have to go for your treatments or counseling. Then habits must avoid for good sleep, because some habits, they will interrupt your sleep. So you have to avoid such things if you want to get good sleep. So you have to avoid afternoon naps. Then avoid heavy meals in the night, especially prevent ama ajirna. Then avoid adaraniya vega dharana, especially before your sleep. You have to finish your all mala, mutra, pipasa, likewise that vega. So then avoid excess liquid after 6 p.m. because if you take more liquid in the evening time or night time, then you have to go to washroom regularly in the night. So it will interrupt your sleep. Then avoid caffeine, alcohol, and nicotine late in the day. Then avoid bright light and loud sound in quiet sleep areas, because earlier also I mentioned, while you are getting a good sleep, you need quiet place. So if you're getting any bright light or loud sound, it will interrupt your sleep. So next is avoid watching TV or computer late at night. And avoid diuretics at night. Some patients, they need to take diuretic, but they are not allowing to take at the night, because if not, they have to awake in the midnight several times, and avoid sleep suppressive medications. Sometimes they are taking some medications for that other conditions, but they already suppressive their sleep. So it is not good for take sleep suppressive medications, especially in the night. Then how Ayurveda helps for sleep. Then here they have mentioned Vata balancing oil massage for hands and feet. I think that madam has showed that nice videos also. Then oil massage for skin. Then marma of hands and feet stimulates stress releasing and healing. Because of that, then they will lead to good sleep. Then Vata aroma oil for relax. I think if you use that agarabatti or other air fresheners with that Vata aroma oils, then they will make a good sleep for you. Then apply Vata hara oil on the scalp. That is very easy thing to you to do, because if you are not getting good sleep at the night, you can use some Vata hara oil for your head in the daytime and also in the night also. This is does not go near one who massage his feet before sleeping, just snake. Do not approach eagles. That is the Ayurveda quotation given about massage and the sleep. Then thank you very much for your present, your kind attention. Thank you. Good night.
Excellent, excellent, madam. Excellent as always. Great, great listening, great listening. You have covered everything. Great. But just see the creativity of our Ayurvedic experts. Topic is one, but presentations are quite novel, unique, and innovative. Really, hats off, hats off. Matra Shakti Jindabad.
Thank you, sir. Everyone.
आवाज नहीं आ रही.
How are you? Thank you, thank you. So rightly told by Dr. Pawan Sharma ji that not only Matra Shakti Jindabad, but it's really an information that whosoever is a guest speaker, he is not known about the speech of the other speaker, but when he or she starts, the stuff of that speech remains always different. So this is what the beauty of our webinar, no doubt told by Dr. Pawan Sharma ji. Important sectors has been wonderfully covered by you with the help of the modern medicine and Ayurvedic support also. I've got two small questions, maybe of great importance for all the audience and that too for you also. Number of types of sleep you talked about, nidra, sleep, whatever. But I think for yourself, being a surgeon, you have got a very good person known anesthetics who gives the general anesthesia for you to make a wonderful sleep to your patient, and you perform painless surgery or the surgery which is not known to that patient. So this is one type of sleep also introduced by of course, with the help of the medicines. Now some local anesthesia is there where patient is always awakened. But my very important question and you may take it in a very light mood, since you are covering 20 years of work on the psychological patients also. So this whole August gathering be enlightened about, especially because you belong to Lanka, Colombo. Can you inform us or enlighten us regarding the Kumbhakarni Nidra? The question, पवन जी हमको भी कभी कुछ जोड़ लिया करिए, हम भी नए ही लाते हैं. What may be your concept or the psychological impact of Kumbhakarni Nidra, if at all any information, because we are talking about the 5,000 back of our Ayurvedic science, and it is Yug Yugantar ki baat hai, Treta Yug ki, but now which is in practice in a form of idiom, that our officers are having the Kumbhakarna Nidra and they are not letting the files in movement so that the work is not getting done within the stipulated time. So can you give some information, because it was our goddess Saraswati, by her intervention, Baba Tulsidas ji says that Magi need mas sat keri. Lord goddess Saraswati was asked by Indra Bhagavan that you make like this. So have you got any concept that too, because you are the resident of Sri Lanka? Would you please?
So actually, I am not having that much good idea of that, sir. Sorry,
Any
sir.
concept, any historical background which may be running in your country or not?
I think is not, sir.
But I can say, it is not that it is not that Lord Kumbhakarna ji asked for the 6 months sleep from Brahmaji as a boon. It was not. The fact was this, that he was given such a wisdom that he asked that you make me sleep for 6 months, and then only one was the common working day. On only one day he was supposed to take diet and then again sleep. So he was sleeping round the year. Only 1 year was the common working day, because he was not attending any sort of Dincharya, Sandhyacharya, Ratricharya, Drisharya. So Vega Vidharan was also implemented in her personality. Resultantly, it is referred that he was advised by Goddess Saraswati that he asked for the 6 months sleep, and one was the common day. This is up to my knowledge. So if you can add on, it will be my pleasure. Rest I will tell in the closing session.
Thank you. Thank you, sir. Yes, please.
Sir, in our country also, we are using that if you sleep lot in the day and the night, we are telling you are just like sleeping Kumbhakarna. I think it has come like that only.
Because in his case, if a person will continue 6 months sleep naturally, then he will not be in position to remain awakened for 6 months. He will become so lethargic and so that. Anyway, thank you so much. Thank you.
Thank you, sir.
Thank you, madam. Thank you, Priyadarshanee ji. Kindly join us whenever you have time and bless this platform with your motivational speech. You are inspiring. Excellent, madam. No doubt, excellent. So now I would like to request, thank you, madam. Thank you. I would like to request our resource person, our well-wisher, our supporter, our guide, Dr. Bishnupriya Mohanty ji. Today is Holi and all Matra Shakti are blessing us on this platform. I salute them. Welcome, madam. From SHIRODA, Gomantak Ayurvedic College, head of the department. Welcome, madam.
Is my slide visible, sir?
Yes.
So my namaste to all dignitaries, Agnihotri sir, Pawan sir, Bishnupriya Sharma sir, Rajan Patenkar sir ji. I hope this. So today we all are sitting here to discuss how we can use sleep as a weapon to eradicate or treat diseases. And for that sake, we are giving more emphasis than the food too. And we all know and aware about how these are the upastambha and how to sleep. Much about those aspects has discussed. and when to sleep, how much the sleep should be, and the extent of discussions now reaching to the inquiry about the typical pattern of sleeping pattern for Kumbhakarna and all. So continuing to these discussions, there is much importance of nidra for health. This we all agree. Now still we are not getting solutions for some other group of patients, those who are suffering or that sleep itself need as a therapy for them. So how we can give a excite or applicable procedures of treatment for those group of patients, like a case of anxiety, like a case of depressions, or the case of schizophrenia. This sleeplessness are still a challenging problems. Even though all these solutions are there, even though all these solutions we are practicing in our routine in our hospital management, but still some questions are there. Still some gap is there. How we can manage those things? How we can make a bridge in between? So some disturbances are there within. Some disturbances are there in the clinical practice. We need to refocus, or we need to re-understand those links. So we will discuss about the benefits of Nidra. We all aware about it, but matter is that we still not living with those informations. So we should have a practice. We should have a dedications. We should have inclinations to those informations, to those instructions given in our classics. Just not to speak to somebody else. It is not just written to write a prescription papers for some patient. It's not a, this is the sleep tablet, you take it and you'll have a good sleep. Or so it is sometimes to characterize the emotional factors. It is sometimes to make a bridge in between the person's own emotions, own psychological factors, even the the nutritional status of the physical body too. So those aspects are need to just improvise or decode the concepts. So proceeding to decode the concept, we can think, say, if throughout the day I have been instructions to sleep for 6 to 7 hours. The rest of the hours I have to work through many numbers of gadgets, sometimes many numbers of people, sometimes many numbers of responsibility. So that times our brain continuously remain busy. Now we have to just give a training to ourselves during these periods, how I can get little relaxation periods within that. So I can be more potentials, I can be more contributory to the next job what I am taking in my hand. Because in between, if I'll take a relaxations, then the neurons itself, or the swelled neurons itself, releases the chemicals and it gets relaxed. And the relaxations lead to a good conduction. And that good conductions will lead to a connectivity or focus point in the work. So that might be the sense of Dhatu Samyata. Because in the Vaisamyata, we have to make the balance. And balance point is depending upon how far our each and every individual cells are enthusiastic to work. So it is the questions comes that Kapha is Tamaguna dominancy. But being Kapha is Tamaguna, but Kapha the Prakriti persons is Sattika. So that is only because the Guna has compounded or structuralized in a proper way of the particular dosage. It is necessary to just it is necessary to put it into its own quality, using at its own proper times and giving the their efficacy and applications. And for that, there are 3 ways of connectivity are there. That's like the sensory neurons, the interneurons, and the motor neurons. So these 3 things should be interconnected, and there will be a good channel in between those. So when we are thinking about the sensory neurons, they are just giving the instruction or passing the instructions, and in between the interneurons is just passing those in a proper way. So the frequency, the velocity, the receptions, or the passing informations should be in a Samayoga. So Samayoga, that's another principles of Ayurveda for the acceptance or the rejections of different perceptions. And then there are some things instructed in our classics that how we can bring or establish the sleep in the peoples. So these are the protocols through which each and every protocol should be fixed. How the Abhyanga should be, when the Abhyanga should be, how much, or in which seasons. Just the questions was discussed that how the Udvartana should be and how the Udvartana work for bringing a good sleep. So Udvartana, that is very clearly mentioned, Udvartana Kapara Medasaha Prabilayanams. So that is Medasaha Prabilayanam, that is creating a coating, and that covering or coating of fat lipid that actually not able to, not prohibiting the passing of perceptions, passing of informations. And when that prohibitions is there, when the obstruction is there, slow down perception process is actually creating confusions and interfering the process of perceptions. Therefore, we can see the soil that aeration should be. So the aeration of human systems depends upon the use or applications of Abhyanga, Udvartana, etc. And another way we can understand by applying this Abhyanga or Udvartana, it is Vata Samana. So one simple question we can ask that when or Haya the Samana Vayu stay. So Samana Vayu, it has taught to us Samana Vanni Sangsitams. So usually it is there. But before taking food, we should take a bath. Now, why? But nowadays trend is something else. Just it was a discussion, part of discussion also. That before going to take a sleep, you should have a hot bath. Now, point is that now, classically, it is done. So when a person is going to eat, he should take a bath. And before bath, he should have a Abhyanga. And that Abhyanga is actually Vata Samana. So Vata Samana, during that procedures, it is instructions. Or Abhyanga is instructing the Samana Vayu. Now you just go to Bandhi Pradesha. You already did your jobs of Sarakiti Vibhajana at Dhatu level or at the Tuak levels. Now you should instruct or you should go there to the Bandhi Pradesha. So it's a passing the message to the Samana Vayu. Don't activate in the whole body. Go to activate in the Jatragni Pradesha. So this all way or the each and every point here to be discussed to establish or to bring the Swapna or Nidra to the systems. And then we can put these questions also that when actually we feel that there should be the application of sleep therapy. So the very biggest point comes insomnia. Now insomnia are again to understand how it is epidemics, that statistics I kept here, and it is written in our classics. It is Bhata Jananatmaja Vikara. So it is not now a problem. It's a problems of long back, and it is just not a problems we are creating. It is because we are more attracted to that glamorized society. That's why we need something more. What is exactly it's not needed to our life. And that attractions, that involvement of social glorifications in our individual lives is compelling us to suffer such variety of diseases. And therefore we become a victim of referring to the expert of sleep therapy. And therefore when the exact times the patient should refer to an expert of sleep therapy. So the point has kept here that when typically the patient will suffer the irritability, the drowsiness, and sometimes with all sorts of home remedies, may not have a good sleep, not for once, repeatedly, then that's the times the patient should refer to the experts. And through these all investigation procedures, we can check that whether his complaints or the subjective complaints of the patient is actually should be entertained, or it is just can be solved by counseling and all. So it is a gradation should fix through all these variety of investigation. One to investigation I have kept looking to the time periods. So how to check that as a person is sleeping through the different stage of sleepings, that is REM management, and that way we can think about the movements of eye, the leg, the different muscle reflexes, etc. we can check whether the person have a good sleep or not, whether he can be kept under just a counseling variety of treatments, or we need a drug variety of treatment, or we can proceed for panchakarma or such variety of some typical therapy. And therefore, I kept few slides to understand the stages of insomnia, and all the stages are, varieties of insomnia has discussed here in terms of the durations of the sleep, that how much durations and the quality of sleep too. So on basis of these two criteria, the classification has made here. Now referring to the classical informations, if we'll search these information from our Charak Samhita, Sushu Samhita, then many times we just confine ourselves to the definition of Nidra or Atinidra or Samyak Asamyak Yogalakshana, etc., written in the Charak Samhita Sutra 21. But it is not sufficient to looking into the clinical applications or the numbers of patients who are clinically coming to us for the treatment. Now, my question is that is these group of people are suffering sleeplessness? That's why I took this reference. I leave for the audience, guess from which chapter this shloka I kept, because this is typically a shloka retaining or emphasizing on the Vibhrama concept. What is Vibhrama? That not in original place. Vibhrama in the sense, Brahma, of course, English attractive word is Bhataigo, but it is not the real sense of meaning. The real sense of meaning is where it should be, how much it should be. It is not in its own place. It is not in with its own quality. So it is Mana Vibhrama, Chinta Vibhrama. We can see the words Mana Vibhrama, Chinta Vibhrama, Buddhi Vibhrama. So the Smruti Vibhrama, there are Ichha Vibhrama, Sila Vibhrama, Bhakti Vibhrama. There are Vibhrama is applicable to these all words. So what it means? Mana Vibhrama. What is the main functions of Mana? That is Bhava, Abhava, Buddhi, Utpatti. So if Bhava mein Abhava, Abhava mein Bhava, if Mana is working actively on that variety of understandings, that what is Bhava, we are not interested on those, and what is Abhava, we are more interested on those. Similarly, Chinta Vibhrama. So Manasascha Chintamartham. Okay, but whether our Mana is doing real Chinta. So Chinta means analysis, Chinta means critical thinkings. So where we should put our focus to do the critical thinkings or critical understandings. Similar, we can proceed for the Buddhi Vibhrama. So Buddhi is Nischayatmika Buddhi. Nischayatmika is Nischitikaranam. Certainly it should be. So where we should remain certain, we are fickle there. Where we should be fickle, we are serious there. So this is a Buddhi Vibhrama. And throughout the years, we are funny. We are making the funny of our own life. So that's a Buddhi Vibhrama. And further proceedings, the Smruti Vibhrama. So we are not certain or sure about what we know. We are doubt in every. We are doubt in, if we will think, we will inquire ourselves, 4 sentences in particular one language, we may not capable to speak. Sometimes we take the help of Hindi, English, Sanskrit, so mixed together. So we more attracted to the mixed bhaji, not a purity. So of course the creations is not possible by the purity, impurity is there, but how much extent of impurity we should bring to our life, and these all are creating pragya parada, these all are creating a sattva samjoga, and the leading cause of sleeplessness or the sleep therapy to be decoded and applicable. So each and every point we can discuss here also, Bhakti Vibhrama, Sila Vibhrama, etc. And now question is that where to apply. So if the person is habituated to the smoking, alcohol, caffeine, etc., then there is a chances of sleepiness, and there is chances of insomnia. If the person is habituated, to change in the schedule of the works, so 6 months within the SIP and 6 months in the state of Goa. So that definitely there is a change in the circadian rhythms, and they are supposed to treat it under the sleep therapy. And sometimes the change in the environment, change the place, change the room, change the place where the person sleeps, sometimes the position itself. So there are different biological factors which impact on the good sleeps. And further proceedings, we can see here the sleep apnea is there. There are many chronic diseases which leading towards the sleep problems we have observed in the COVID waves too. And certain medicines, if the persons when the medicine sectors comes, we all can agree, or we all are aware that the list of medicines are many times more than the necessity, because the influence of doctors, because the influence of hospitals, because the influence of industry, the people are taking like the part of food. So that creating many times sleeplessness. And the the electronic gadgets hugely available in our hand. So many way, and we don't know exactly how much I need, how much we need, how much we should take the help of gadgets, but because it is available, so we are using. So this become a part of lifestyles. We hardly conscious that how much amount of electronic gadgets is needed to my life, and I will be comfortable to them. So our corporate greed has not permitting us to aware about the use of such things, and therefore we fall under sleeplessness or insomnia, and therefore the sleep disorders or sleep therapy is necessary to unfold. And proceeding towards the sleep therapy, that if it is not taken in proper times, then what are the changes or what are the possible diseases will be. So we know this list of problems, that is like Shirasahasunyata. It is always a restlessness, variety of feelings. There is some abnormal sounds, or we may not focus on hearings, we may not focus on thinking a particular subject to its deeper sense of meanings, and these all way we can diagnose the patient, or we can diagnose the situations, or we can teach the patient to aware about the preclinical conditions, because this should be the trained or developmental science sign should be that how we can able to catch the disease prior to its manifestations. And further proceedings in further pathology, the disease might little become more serious, the conditions become more serious, and that can lead to some physical diseases too. The list of diseases is written here, you can enlist here, like the disease like Udavarta, disease of Ardita, many such Vata Vikara or Nanatna Vata Vyadhi are possible from or during the progressive conditions if the disease is not treated. And now how it can be beneficial to us. So by providing some way, by medicines, by panchakarma therapy, by some way we can able to provide the sleep to the patient, then a melatonin secretion through that pathway, the insomnia case can be solved, or this is the way how patient get benefited. And if we will go through these steps, many part has discussed, like application of Madhura Rasa, the using relaxation techniques, yoga and meditation and all, using Shirabhyanga, Padabhyanga, tremendous benefits for bringing Nidra. And if you see the medical legal aspects, the plasma, the lividity cells, the rigidity of the muscle cells in the eye muscles and the foot muscles, same timing, or timing is very same. So that is proving that the Padabhyanga itself is a good benefits for eyesight deficit or the insomnia problems. And all these systems of digestive systems, the endocrine systems, the nervous systems, all are going to get controlled by the sleep itself. And what are the different environmental factors? So the surrounding factors should be corrected when we are treating or handling with the sleeplessness patient. These are enlisted here, we can see, and better discussed by the other co-speakers. And there is a need of some ardent therapy with some regions. And these are highlighted already. That's how the Pichu, even if we're not capable to do the Sirodhara, or always not easy, but very, very simple and very easy used to, that is like Pichu Kalpana, or with Khirabala can be, or with any simple oil can be. Because if we'll ask or take a Google survey data of 100 people, just ask a simple questions. When you put oil in your head, hardly will get 10 to 15% of people will say yes. So recent futures, within 2 days, 3 days, how many days before you put the oil on your head? So these are the reasons we like to be some things, and we are going to some things. This is the hierarchy of our today's lifestyles. And these are the list of medicinal plant, what can be useful in our clinical practice. So we can get the information under the Medhya Rasayana, Khirena Yasti Madhukasya Churnam, or we can get the Manduka Panya Sarasa Prajujya. So Manduka Panya Swarasaha. Now, one point, even this information is well known to everybody else here. But one message I like to share here, written Manduka Panya Swarasaha Prajujya. So praise after taking toothbrush or dant gisne ke baad, early morning, it is better to take few leaf and chew it for a while. So chewing, giving a fresh juice, and that will be work as a Madhyarasayana or good impact on the brain. And now thinking about the medicinal effect of Mandukapani, the Mandukapani is tikta. Now questions should come. You are speaking anidra or sleeplessness, insomnia, nanatmaja bhatavikara, and you are administering tikta rasa. So question should come. Now because it is tikta rasa, vayu akasa dominancy, of course it could be a medicine for anidra. Now in which variety of anidra? This is a question. So anidra might be because of marga vrodha, anidra because of vata vruddhi, anidra sometimes because of nutritional deficiency. So if there is a nutrition, but that nutrition has not yet channelized, therefore we need a tikta rasa dravya. So there is a vayu akasa dominancy, and vayu when travel, akasa give the way to travel. So that's the particular clinical conditions where we should select the Mandukapani. In some other cases, we may feel the nutritions that should be a constitutional nutritions or the structural nutrition is needed, then we can go for Asogandha. So these things to be highlighted. And here the person is influenced by Bhuta Badha. So now question can cast, then what is Bhuta Badha? The moment the students ask Bhuta Badha, Bhuta psychiatric problems. They please don't speak this variety of terms. Bhuta means past. If a person's past is trapping its present, that is Bhuta Badha or Graha Badha. So it is Grahana, catching, influencing. Grahana means influencing, catchings, trapping. So your all thought process is trapped by your past experiences. That is Bhuta Badha. Then give Jatamansi, because it is Bhuta Gnahara. So that a variety of message should pass. That was my intentions, even though the term such comes, but the way to present those terms is still not having, still lacking in the passing the informations in the public domain. So similarly, we can proceed for other yoga, sleep therapy, etc. Now, the term when yoga comes, so many numbers of points, and so many numbers of things comes. These are the instructions of yoga well available in the health domains. Google's any heritage available. The matter is that how far we capable to actualize these things. So actualizing those things, practicing those things in our day-to-day lives, that can give a remedy, or that can give a expected remedy to our systems. And the very next important aspects is the concept of Sattva Bhaja counseling or hypnotherapy. So then treating the patient, educating the patient might have some more value. So why and how to follow these concepts, that to be clarified in terms of their biological actions inside the systems. So if a person will sleep in a dark room, how it is beneficial. If a person will not use the electronics gadget before sleeping, how it could be beneficial to the patient. So it is that part of patient educations we have to give somewhat little more times. So it is not in the form of prescription times, it should be in educations or counseling varieties. And sometimes a typical hypnotherapy cases, because we can see in the society, our society statement or the situations has made in such a way, when we'll try to link Chalasanda Sutrasthana 9th chapter, where Kuddaka Chatuspada, there are 4 things as discussed. Here, in terms of sleeplessness or insomnia or typical manasika vyadhi, where anidra is a complaint, on those cases, rogi should not be the 4th pada. Means out of the 4, rogi should be discarded, and rogi ke jaga par society sabd rakhna chahiye. We should put the term society there. Why? Now society is something going wrong, because social health, that is branding those variety of patients with different visions. Therefore, many people, even though suffering anidra, they never speak, they never consider, they never conscious that as a clinical problem. And therefore it become more grievous. And society never received those things. And to be very frank, we can see that the peoples who are really truthworthy, those who perceive the correct things, they are unable to put the matters in front of the society in a glamorized way. Therefore, they suffer the anidra. Therefore, they suffer the manasika vyadhi. And the society never excused those peoples. The society never received those peoples with their own reality. So, we speak truth and reality have a big differentiations. So that to be treated, the society to be improvised, or the society to be trained for these things. Rather, one day may comes, Atattva Vinivesa Charak Samhita quoted as only one Mahavyadhi. So a question should comes, what is Mahavyadhi in Charak Samhita? Atattva Vinivesa. Atattva Vinivesa. जो तत्व नहीं है, जो सच नहीं है, reality नहीं है. If you are indulging on a tattva, that could be a Mahavyadhi. And saying Mahavyadhi is the sense of meaning is that the whole society is suffering this disease. And that's why the question is asked by Agnihotri sir, what is the Kumbhakarna Nidra? Don't you feel that whole society is under Kumbhakarna Nidra? So we have to think about these questions, or about this variety of answers. So this is the matter to say that hypnotherapy, and those patients should come under hypnotherapy. We have to just awake them that you are 100% true. The society is actually not fit to receive you. And when you are approaching yourself, you be 100% truth. When you are approaching a society, just little approachable forms or applicable form, bring in applicable forms. So that could be a treatment protocol there. And there are some typical treatment procedures: Vitrasana, Vismapana, Vismarana. These are the very typical cases or procedures or protocols in case of Unmada, Apasmara variety of treatments. And Anidra, to establish the Nidra, instead of going for some typical chemical medicines, we can also proceed for these protocols. Now taking a pause, I like to ask these questions. One of my co-speaker was speaking that getting a good peace out of the Nidra is the real target. Now question is that if getting peace is the main target of sleep, then do we all are satisfied, or we have a peace in our own life? Why this question I am asking? Because the society where we are, they are whole ready कि अपने लड़की अपने बहन को उस ठेला वाला के साथ शादी कराने के लिए. Nobody will agree. 15-20 लाख खर्चा करके इंजीनियर बना होगा, और उसके बाद और 10 लाख खर्चा करके MBA किया होगा, महीना में 60-70 हजार कमाता है, टाई सूट बूट में आता है, उसको देने के लिए तैयार हो जाएगा. So glamorizing such factors, that is glamorizing nokri, that is actually dominating in our society. So we have to awaken the society from that ground, because swatantrata pratishtha hona chahiye. So we should glamorize the swatantrata. We should glamorize the independency. Do I are independent actually? If I am independent, then definitely I will get the satisfactions. So santosh kahan gaya? We have to search out those things. I have rich amount of money. I have a rich amount of relationships. Bottom दबाते ही इतने लोग मुझे हाय हेलो करते हैं व्हाट्सएप में. Now फिर मैं सुखी क्यों नहीं? मैं संतोष क्यों नहीं? मेरा वो निद्रा कहाँ गया? वो निद्रा कहाँ खो गया? So we have to think स्वतंत्रता का प्रतिष्ठा करना है या नौकरी का प्रतिष्ठा करना है. ये माइक तब तक अच्छा लगता है जब माइक उसका परपोज का सॉल्व करता है. जब माइक खुद का आवाज निकालता है तो हम उसको निकाल के फेंक देते हैं. So we have to think about those causes in our lives, in our society, in our day-to-day, lifestyle procedures. Why I am keeping these things? So I few slides I kept here. Adi Shankaracharya has opined the truth and reality in between matter and energy. Nobody listened to him, and this Vedanta Darsana now glorified by some other Western countries. So our focus to the Eurocentric concepts. Still, we are in the deep sleeps. We are supposed to prove our science. दिखा दो आपका आयुर्वेद साइंस है क्या? Why these questions we have to face, even though it is true like sun and moon. Now, concept is that when we are passing time, just wasting our times, 15 बरस आयुर्वेद पढ़ाई करने में गया और 20 बरस सिर्फ सरकार को प्रूफ करके दिखाने में नहीं जाएगा. लोगों का भला कब करेंगे? सोसाइटी का भला कब करेंगे? So we have to think why we are so I'm deeply actually regards to Pawan sir that he has created this independent platforms. That's why, because I able to speak this, because ICMR guideline protocols in the research, I cannot do these jobs. See, we can watch the data during COVID waves. So many numbers of people get benefited by Ayurveda. This much is not sufficient to prove the Ayurveda is a science. सो दिस स्वतंत्रता का प्रतिष्ठा होने के लिए उस नींद से सिस्टम को कब जगाना है, कैसे जगाएंगे? Just few days before there was a webinar where Lakshmipriya madam has asked for the documentations. She is a good teacher, she is a good doctor, she is a good researcher. This much is not sufficient. System is asking to her for documentations. Why not the one members of CCRS should be kept in each and every institution to collect the data? That's their duty. It's not the duty of the doctors. So वो नींद से कब जागेंगे? Sir will definitely agree that when we do the पारद संस्कार, पारद का बुभुक्षा का हम बढ़ाते हैं, पारद का भूख का हम बढ़ाते हैं, हंसेंगे लोग हमारे ऊपर। पारद एक मेटल से उसके में भी भूख होता है क्या? होता है। We all can read about the metal fatigue. There was a experimentation by Jagdish Chandra Bose on 1910 around. So the question has asked, Jagdish Chandra Bose was a physicist. So he was a physics person. Why he should go to try testing the plant have a life or not? उतना भी काफी नहीं हुआ. Then further the question asked to him, metal का life है क्या? And he was experimented in the Royal Science of Royal Society of London, where he tried to put the cyanide on metals, that is iron. लोहा के ऊपर cyanide डाल के he was trying to prove that लोहा will jump off fear of the death. And during his procedures, cyanide was exchanged with water, and he confirmed about his own concept. And that times, now when the experiment going to fail, he drink that one. He was so confident on his understandings, and the whole galaxy of scientists fear that there will be a sudden death to Jagdish Chandra Bose. But he was confirmed in his concept. The Jagdish Chandra Bose, this experiment was more than 100 years. My question is that, कहाँ सोए हैं वो साइंटिस्ट लोग, कहाँ सोए हैं ये सारे साइंस? So we are still on that science. Technology has well developed. साइंस कहाँ खो गया, कहाँ सो गया? उठाओ उस साइंस को, जगाओ उस कुंभकर्ण निद्रा से साइंस को. And do such big things are expected in the systems. Why not we are working on those? Why not we are passing this message? Don't put lipsticks in every flight suffering. We all might have observed. Lipstick use can increase. 1 year use of lipsticks can increase 1 size in the breast size itself. Is it not science? The biggest cause of cancer is lipstick and chemical soda sprayer and all. Why not we are passing this message? Why not we are just encouraging the peoples that understand the purpose of your life? And if you will fail to understand the purpose of life, then you cannot just get satisfied with your life. So thinking about the Sarvachya Swapna. So what is the biggest dream of your life? वो नींद में भी देखा जा सकता है, जगे हुए भी देखा जा सकता है. So हम सोए हैं या जगे हुए हैं? We have to think about this, because पढ़ाई तो इतने सब कुछ किया, लेकिन कौन सा पढ़ाई काम में आया? वो जुगाड़ कभी कर पाए क्या? So जुगाड़ कंपनी टेस्ला. So this person was with Vivekananda for 15 days. He developed the all jugaad company, all instrumentals, equipments related to the electricity. So it was just a continuation of Thomas Edison innovations. So क्या confidence रहना साइंस के अंदर कि मैं आयुर्वेद का बहुत कॉन्फिडेंट हूँ, फिर भी मैं सोया हूँ या जगा हूँ? ये क्वेश्चन कभी पूछा है क्या? So we have to ask these questions, because जीवन को देखने का एक दृष्टिकोण होना चाहिए. So जीवन को देखने का जो दृष्टिकोण है वो हमारे पास है या नहीं है, या अभी भी हम सोए हैं? We have to think, we have to improvise those aspects. Now this concept has taught to us that ईश्वर is well available everywhere. कण कण में भगवान है. तो फिर क्वेश्चन क्यों नहीं पूछ रहे हम कि ये पत्थर लेडीज है या ये पत्थर जेंट्स है? अगर लेडीज पत्थर है तो उसमें गणेश का मॉडल बनाना चाहिए, जेंट्स पत्थर है देन जेंट्स गॉड बनाना चाहिए, because it is written in our स्थापत्य विद्या. So why not we are decoding those स्थापत्य विद्या? It is necessary to think about those concepts. This is the finger marks. We all know 7 to 8 Arab peoples in the whole globe. Still we are unique in our finger. So we should think ourselves, हम कोई आम नहीं है, हम खास है. सो जगा दीजिए उस सारे स्कूल के बच्चों को, बता दीजिए कि आप अपना जिंदगी का पर्पज ढूंढ लो, जिंदगी का पर्पज को ढूंढना ही एजुकेशन है. So that is the real goal of education, that how to think about your own purpose of life, without which one incident I like to say here, when APJ Abdul Kalam failed to get his service, he went and just he was trying to die. पीछे से किसी ने खींचा, वो शिवानंद स्वामी पीछे से खींच के पूछ रहे हैं, तुम्हारा आंख कह रहा है तुम कुछ गलत काम करने जा रहे हो. So just get up, and then you all know what he did throughout his life. We can read about these whole concepts. Even our Prime Minister Narendra Modi, we can think about Amitabh Bachchan's. There are certain reasons behind our life. There are certain reasons behind our worth. So why not we are thinking about to unfold the reasons of our own lives. The entire gamut of activity in the medical systems is to treat the disease. Despite of all wrong going in the systems, despite of all wrong going in the medicines, we have to think about something good going, or something good in our text, something good in our thought process, or about our own science. So the differentiation in between the sleep and awakenings. So these terms, awakening in the sleep, sleep in the awakening conditions, little confusing, but still it is, we have to think because of for its or endless or boundary cross applications. So since from the birth to the death, there is B and D, and there is C in between. And C is to search about the cause of every problems around to us. So if we'll go to understand deep and deep about all these factors related to the cause, standing in front of a big mirror, because mirror is essential. That is the only one thing where we can think, see ourselves, where we can think about ourselves. So we can ask these questions to ourselves. And if not, अगर हम ऐसा नहीं पूछा, अगर हमने ऐसा नहीं ढूंढा, if we will not unable to link those purposes, then the security of our lives is still under question mark. So world was not, world is not, and world will never be fair to anybody else. This is very concrete truth. Sarvabhaumik Satya, a universal truth. World never was fair. World is not fair. World will never fair to us. It is we to stand. It is we to work. Either you be strong or you serve to the strong peoples. And repeatedly Pawan Sarma was speaking that Matru Sakti, Matru Sakti. So Matru Sakti, that strength is with the Matru Sakti. And just here a team of speaker has designed from the Matru Sakti itself. And usi Sakti ko naman karte hue, I just coming to the end of the topics or the discussions. That is, we have to understand the cosmic pain of our creation. There is a cosmic pain. जब माँ बच्चा पैदा करता है, the labor pain is the biggest pain of human life. लेकिन माँ खुश रहता है क्योंकि वो माँ बन रहा है. चाहे बच्चा बनने के साथ साथ माँ बन रहा है. So वो माँ का भी एक जन्म हो रहा है. That we should not forget. So searching about the physical sleep, the awakening inside the physical sleep, and we should think about the emotional sleep. We should think about the psychological sleep, and here we get satisfied. So वो नींद में सुख नहीं आता है. नींद नहीं है तो भी सुखी हो सकता है. 7 दिन तक नहीं सोया आदमी तभी वो खुश है क्योंकि वो एक थेसिस बना के लेके आया. Because the last date is approaching, and after the 7 days he forget that I have not slept since 7 days. But still he's peace, he's cool because the creation is there. So that a cosmic pain of creativity and doing something good for the others. That's the message of the real sleep benefits. And if we see the Hindu Sanskriti itself, the Asara Ekadasi, Harisayana Ekadasi. So it is the symbol of sleep, that is the cosmic rest, or thinking about individuals or our own actualizations, thinking within, connecting within. who am I? What is my purpose of life? So अपने का खोज. So you see, अपने का खोज is the biggest खोज, biggest innovations, and ending towards the Kartika Ekadasi, the Utthana Ekadasi. So my message to all the audience who are listening to me, that is, do the Utthana Ekadasi to our own life, and that can solve any problems to us, because improvising individual persons might be a biggest contributions of human life itself. So we are slowly, in these questions can be asked to any global citizens. When they will understand and realize the hidden concept of Vedantic philosophy, they will definitely say these statements that ऐसा मुझे लगता था, I was feeling like so. I'm a Christian, I'm a Hindu, I'm a Muslims, but slowly I understand that we are nothings, we all are one, and we made for each and others. That is the eternity of sleep, and that is the eternity of sleep therapy. So thank you all for your kind listenings and giving the opportunity to share my view.
Great, Madam, as always. You are unique, no doubt. You are unique. Excellent, excellent. I would like to request Vishnupriya Sharma ji, before calling our valedictory concluding remarks. Vishnupriya Sharma ji.
Yes, thank you. Namaskar, Pawan Kumar Sharma ji. Yes, today we have learned many things from the eminent expert. All the experts have delivered their lecture very nicely, and we can learn very new things, very new things. Today's subject is same, best and safe sleep therapy, but presentation is different. Every I offer my sincere thanks to all the eminent speakers for their speech. Thank you to all. Especially thanks to Pawan Kumar Sharma ji for organizing this wonderful webinar. Okay, namaskar. Thank you to all.
Thank you, sir. Thank you. Dr. Jayesh Thakkar, would you like to say something? Our co-host, energetic, dynamic, young practitioner from Calcutta, Ved Jayesh Thakkar.
Thank you, sir. As always, there were lots of new things to learn. And as Madam said, we have to actualize it, make it practical. So there is much to know beyond the words. We say, no, we have to learn between the lines. So I'm grateful to all the speakers. And with regard to lifestyle disorder, the practical aspect of sleep is very important. Today, people are working in night shift and at shiftings. They work at different shifts. Weekly, few days in morning shift, another time in the night shift. So as clinical aspect also, we have to think how to handle such cases. Because if I ask my patient not to work in the night or to avoid mobiles or laptop uses, but screening is also increasing. So some applied point of view also we have to think as per the time. Because our Shastra, as Madam also to read in between the lines, we have to update ourselves with the time. So sanskarit with our time, how to approach a patient with regard. This all are concepts and really true concepts. But how to make people understand, those who are studying in convent school or those who are not into the basics. So this is my request that we should have some map of working it out. That's the little I would like to say. Thank you.
Excellent, Dr. Jayesh. Your suggestion is important because now lifestyle has been changed. Really, it's good. But as Madam Gunarathne ji and Vishnupriya ji both told that in night shift working, in day shift working, they focused on that, but some protocol should be there for IT executive because they are working whole night, hospital whole night. So that is definitely, and shifting duty. So sleep is not on one time. That is also a great problem. I would like to request Dr. Dinesh Kumar Das before Dr. Vilas. Dr. Dinesh Kumar Das ji, your opinion. वेलकम डॉक्टर दिनेश जी। आप तक मेरी आवाज जा रही है? डॉक्टर विलास जी, विलास चंद सरकार जी।
हाँ नमस्ते सर। बहुत ही हाँ बहुत ही सुंदर वेबिनार था, बहुत कुछ सीखने को मिला आज। और मेन जो फैक्टर जो है मैडम ने लास्ट में बोला कि कि सब कुछ हम लोग के पास है, मगर इसको कैसे और भी चैनलाइज्ड करके इम्प्लीमेंट किया जाए, इसका ऊपर हम लोग को ध्यान रखना चाहिए। और ये अगर हम लोग रख सकते हैं आयुर्वेदिक फैटर्निटी के जितना भी लोग है, तो हम लोग आयुर्वेद को धीरे धीरे और भी अच्छा प्लेस में लेके जा सकते हैं। सो थैंक यू, बहुत कुछ आज सीखने को मिला। जितने भी डॉक्टर लोग थे, प्रोफेसर लोग थे, सबको मेरा नमस्कार एंड थैंक यू सर।
जुड़ते रहिए विलास जी, जुड़ते रहिए। डॉक्टर नीलाक्षी देव चौधरी जी फ्रॉम आसाम, वेलकम मैडम। डॉक्टर नीलाक्षी जी, am I audible to you?
Yes, sir.
Welcome, welcome.
It was a very interesting topic, sir. The concept of sleep was very nicely presented, and the main concept of. Sir, am I audible?
Yes, clearly.
Yeah. The main cause of sleeplessness is mostly due to the occupation and due to stress. So we have to train the society and even the business, even the what you say, what is the society and the companies, that we should lower the stress level of the people by not giving much load to people during sleeping time. And even if your sleep is less or if you are forced to work very hard, then you'll have to take some steps, preventive steps, like doing Padabhyanga, doing Nashya, and the person should be aware. He should see that his bath does not get aggravated. Even the students should be trained that if you study hard or you have to face competition, but you should know how to relax, and you have to take Ayurveda. You have to take medicines, you have to take the therapies, and we all should be aware that we are losing sleep means we are having some problems. So preventive aspect and curative aspect. Thank you so much, sir. And I thank all the speakers for the very valuable discussions. It was really very enlightening. And thanks to Pawan Kumar sir for organizing. Thanks to Agnihotri sir and all the speakers. And Vishnu Sharma sir.
Thank you, Dr. Nilakshi. Thank you very much.
Thank you, sir.
डॉक्टर दिनेश जी तक मेरी आवाज पहुंच रही है? डॉक्टर दिनेश कुमार दास जी, I hope I am not audible to him. So I welcome now Professor Dr. V.K. Agnihotri sir for his valuable concluding remarks. Welcome, sir. Welcome.
Thank you. Namaskar. Thank you, Dr. Pawan Sharma ji. This platform of webinar is indebted definitely for the knowledge poured to this session by all the four guest speakers. We'll comment one by one, but before that, I start my valedictory remarks. Our respect and regards to Professor B.P. Sharma sir, Professor Ved Rajan Patankar ji, all the four speakers, Professor Madam Gunarathne, Madam Priyadarshanee, Pratibha Shah, Professor K.C. Priyadarshanee, and our Bishnupriya Mohanty ma'am, along with Rajan Patankar ji, with Jayesh Thakkar ji, and our three new speakers, not new, but not, who joined today's webinar, our Dr. Sarkar, Dr. Chaudhary, Nilakshi Chaudhary, and Dr. Dinesh Kumar. I may start retrogatively because I may miss the important point. Madam Bishnupriya Mohanty, as ever, when she starts speaking, probably she is not knowing where she will stop, and always in a form of some putting questions. So as your one Hindi sentence that हमारे साइंटिस्ट कहाँ सोए हैं, आपने ऐसा बोला, मैं इस सेंटेंस को थोड़ा यूं सुधार लूं, हमारे साइंटिस्टों को कहाँ सुला दिया गया है, राइट फ्रॉम जेसी बोस टू आवर होमी जहांगीर भाभा साहब. सोचिए जरा, हम भारत के कितने बड़े रत्न हैं जिनको भारत की धरती को छोड़ के कहीं और जाके अपनी एबिलिटी और अपनी डीप नॉलेज और साइंटिफिक अप्रोच को बताना पड़ता है, और जब वो स्थापित होती है तो वो हमारे लिए ही कम पड़ जाते हैं. इसको हमें ये भी विचार करना है. आपने सेल्फ और सोसाइटी की बात रखी, हमारे यहाँ ही पैदा होते हैं और रिकॉग्नाइज कहीं और किए जाते हैं, जो भी है. खैर, our start with Professor Dr. Pratibha Shah. As I told earlier, she was a little bit indisposed because of the tooth extraction, but she put forward all the concepts of modern science regarding the sleep and the causes of insomnia described in Ayurvedic text. Even 2 point is still there, which is not been covered by all the 4 speakers. As I am a keen observer and listener, I can put today that one is Nidra Nishruta Prokta under the chapter of Sandhya Kalin Varjit Karma. Etani Panchakarmani Sandhyayat Varjit Buddha. There comes the Nidra Nishruta Prokta. Nidra Daridra ko lati hai. So it can be also discussed in the form of a scientific approach. And the other one, which sector is not been touched by any person because probably specialist was not there, though we are all having the knowledge of that, and that is Avhav Vatrya Lamna Vettir Nidra. Nidra has been described in yoga science as a vritti. When we talked about, and it is well enjoyed by the person himself, so it is a personified concept. Society support, wife support, husband support, children support, supportive and conducive atmosphere of the bedroom, everything is there. Persons are having so many ideas whether the any god goddess picture be there or not, and so goes the case, especially for the posture. Ramdev ji says that it should be left lateral posture because the stomach has got the food content, so it should not hang if we go further right. And if we just start having a straight posture, the natural curvature of the material column may disturb. So it's a left lateral posture also. But at the same time, it should also be double, triple underlined that our head should be towards the south direction. That will also be equal. That is in reference to the magnetic force of our earth. Preferably it is the south direction or to the our east direction, but never to the north direction. So these sectors still what I learned is there are so many things. So Dr. Pratibha Shah's contribution regarding the causes, निद्रा नाश के लक्षण, निद्रा नाश से होने वाली हानियां और इनका कवर अप करने के लिए उनकी रेमेडीज from all sectors. And what I was teaching for last 30 or 35 years, that the physiological concept of 3 nidras were how? The one is, it's a swabhaviki, sam utpanna, shlesh samudbhava, but in that way, it as a part of habit. Russian scientist Pavlov established the fact that it is a conditioning reflex, and he experimented for the dogs with the well, with the bread, and ultimately no well found, no bed, but at the time of the usual this thing, so it's a conditioning reflex. Another one is the synopsis of the dendrites and axons and dendrites. When there becomes a induction or gap, person sleeps. And the third one, whenever there is a lesser quantity in brain, then patient falls in sleep. So modern aspect is also very much there. So our yoga is Avhav Pratyaya Lamna Vritti. When we experience nothing, even no vritti will there, one will fall asleep according to the yogi science. So Dr. Pratibha Shah is spoken very well, and our second one who talked about the Ayurvedic concept very well, as far as this her concept regarding the remedies, especially she talked about the remedies, which also covered the Shirodhara and all the Abhyanga, Udvartan. These factors were there when our Vineetha Kurup was talking, and so goes the case with our Gunarathne madam. We had a good question, or also with all types of sleeps along with the Kumbhakarni sleep. And lastly, Professor Madam Vishnupriya Mohanty, she right from the point of the whole of the concept of sleep, but why and how the normal sleep gets disturbed, she touched that area also, and that comes with the Atatta Univesh and the society support, or the overloaded person, day shift, night shift, mood, conducive conditions lacking, and the duration of sleep is disturbed. And of course, this is because of the proper diet. Ahar, then Nidra. So ahar, the taking diet, proper diet is equally important to enjoy a wonderful sleep. So this is all my comments, and Jayesh Thakkar also, Jayesh ji also pointed out very well that all these things should put together for enjoying good sleep, and we are all supposed to enjoy good sleep to have a next good webinar. Thank you so much. Thank you so much. Over to Pawan Sharma ji.
Tomorrow, sir, tomorrow we will be on holy leave, and then day after tomorrow, best oral health care. World Oral Health Day is there. So Dr. Suryakiran Bagh from Kodoli, Dr. Ashok Patil from Belagavi, Dr. Manu Sharma from Jammu. Again, whole cross transverse India. So welcome. Please join day after tomorrow. And I don't think this webinar is complete without Jagdishwarji's spiritual blessings. So I would like to request our guide, guardian, mentor, Dr. Jagdishwar ji from Telangana, for his blessings in the last. Happy Holi, sir. Welcome, Dr. Jagdishwar ji.
Namaskar, pranam to all. Dadaji, am I audible?
Yes,
hello.
Clear as always. Welcome, sir.
As Agnihotri ji just now referred, it is a vritti. Usually, ahara, nidra, bhaya, and maithuna. These four are common in every living being. Why these four are mentioned out of this, others are not our subject? Nidra. Nidra, if it is not there, then for the next creativity or performing the body, some actions will not be fruitful. Sufficient nidra should be there. But at the same time, if nidra goes beyond the limits of, then it will be called as Kumbhakarna nidra. Because usually a specialty will not be titled as a, for example, doctor, professor, lecturer, and all these things how are titled. Then who goes over sleep also called as Kumbhakarna. And of course, Kumbhakarna is a mythological creation as far as my knowledge goes, because so many Puranas are there where these have been referred to teach the society, fall in a line and observe everything in a right perspective. Likely, whenever a man goes for long sleep, of course, these also varied from age to age, as referred our physicians, our doctors in the speeches, that which and which age. And at last, the conclusion will be the less age, less sleep will be for old age only. And in old age also, how many hours is not specified, because on one occasion, my Gurudeva's reference was like this, that minimum should be 4 hours. It will be sufficient. What he mentioned. In cases where the people perform yoga practices, yoga nidra, in that also the yogi can sleep physically for 2 hours also, but rest in case of concentration of his mind, he gains much strength than the bodily sleep. That also being mentioned. Of course, how much and what depth, if the yoga subject is known to all, then it can be understood. At the same time, if anybody loses sleep without medicine or without induction of a specific thing, one can fall asleep if they wash hand, that means from four part of the hand, and from knee to below, and armpits and neck portion, and at the same time putting on neck and ear and all these things, putting water in front, in navel portion, and just opposite to the navel portion, that is at Mooladhara Chakra, and at the same time put cold water 12 times to the Bhrukuti, then one will get easily sleep. This is systematically prescribed for Ananda Margis, especially before going to sleep. If they do, then there will not be disturbance of sleep. With this, I conclude. Thank you, Dadaji.
Great, sir. Great.
Hello.
You always highlight excellent new point. Great, sir. Thank you. Thank you for today. Good night. Thank you. Gratitude to all speakers and audience dignitaries, because all are dignitary. Thank you very much.
Thank you.
Thank you, sir. Thank you, Agnihotri.